Hey, what's going on, everybody?
Hey, everybody, man. This Thursday, welcome to the 2022 Diabetes Conference. I am one of your collaborators, Philip Jones, Second Chance.
Hi, everyone. I'm Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches. Good evening, everybody.
Who's next? Well, good evening, everyone.
Is he?
Jonathan.
Don't want to say nothing today.
Hey guys, sorry about that. I'm Jonathan Trailer, host of Hope with Jonathan, kidney transplant recipient. Glad to be here on this blood pressure diabetes conference.
All right, so straight into this first winner. Wait 1 second. Clicked out on my windows and I shouldn't have done that. Oh, so let me start off with my name is Philip Jones. I am the founder of A Second Chance. On people's and their stories of through their difficult times with difficult times. So we just try to give them that time to really kind of shine and tell their story. Learn that when you give them that time and let it out, it's actually official. So that being said, and I hope I say this last name right. I forgot before we started. Will be Jessica Herlika. Did I say that correctly?
Yeah, Hardlooka.
Herlika. I thought that's what it was, and Bella changed my mind at the last second, so I just went with that. But she's mostly right most of the time. So, with Jessica, dietitian, certified diabetes care education specialist, Theory of Education at Palm Beach Diabetes and endocrine specialist, Needles and Spoons Health and Wellness LLC nutrition coach, owner of Sevlight, that's how you say it, Nutrition LLC. Jessica graduated from the Florida State University with a master's degree in clinical nutrition. She has worked in the diabetes field for over a decade at the largest endocrinology in South Florida and started her own online nutrition coaching business in 2020. She joined Needles and Spoons Health and Wellness LLC in 2019 as a nutrition coach for women with type 1 diabetes, reviewing balance meals, policy strategy, and support in the online ID community. She specializes in diabetes, insulin resistant, pre-diabetes, and has a passion for helping people with diabetes eat the foods without restriction, bigger levels. So I'll give you Jessica.
Hi, thank you. I'm really excited to be here. Is it okay if I share my screen to go over my slides? Let me try to do this here.
Yes.
I'm trying to see. I don't know if
It
let
will
me
be
do
on
that.
with the screen and the arrow pointing up.
Right. So I hit. Oh, okay. Update system permissions to allow recording. Is there something you have to do to allow the screen to share? Oh, can you see it?
Hold on 1 second.
Oh.
Nope, I should. Hold on 1 second. Did you take it down?
Oh, were you able to see it?
Yeah, I had to bring it onto.
Okay. Let me present. All right, so we can see it. That's okay.
Yes.
All right, awesome. So I'm going to be talking about diabetes and nutrition, and I'm really going to be talking about unique eating concerns for people living with diabetes, some of our goals with medical nutrition therapy, some considerations and obstacles there are for trying to eat healthy with diabetes, some nutrients and eating patterns that might be important to consider, current diets that are used for diabetes, and then kind of putting that all together because it can be a lot. So it's important to remember that everyone with diabetes is completely unique. There are different reasons why people get diabetes. Different medications can affect blood sugars. There's so many different factors with our lifestyles that can impact our glucose levels. So it's really important that when you're thinking about your diet, that it is for you and your body, and you're not comparing to what other people are doing. So some of our goals for people with diabetes when it involves nutrition is engaging in healthful eating patterns, but choosing a variety of foods. You know, so often we hear, I'm sure all of you have heard, that with diabetes, you have to, give up certain foods, give up carbs, give up fruits, all these different things. But actually having those nutrient dense foods in the right portions can be really beneficial to improve your A1C, blood pressure, and cholesterol, prevent diabetes complications. And it's important that with changing your eating patterns, that you're still including foods that you enjoy, foods you grew up with, foods in your culture. You don't have to give up any of those foods. It's going to make it a lot easier to enjoy healthy meals. and also to just maintain that pleasure of eating around food, even though you're trying to eat better for your blood sugars, for your blood pressure. And also, doing some planning in advance can help you to achieve healthy meals a lot easier. So it is important to consider that with diabetes, there are some medications that can change your appetite, can change your weight. So if you're struggling with increase or decrease in appetite or weight, I would encourage you to talk to your doctor about that. And also up to 20% of people with diabetes may experience eating disorders or disordered eating. So talking to your physician or a mental health care professional can be really important if some of those start to come up. And with diabetes, often we are still considering, heart health, and some people may have fatty liver or kidney disease. It can be really overwhelming. So I'd recommend meeting with a registered dietitian to go over all of your concerns and the foods that you like to help you put it together. So there are some current obstacles too with our environment. Certainly changing these behaviors around eating, exercise, they can be difficult, and we acknowledge that. But remember that, small changes usually lead to success, and you don't have to change everything overnight. Definitely consider where you're getting your nutrition information from. I mean, of course, everyone on here today is getting the right information, but there are some, a lot of misinformation online and social media. So really consult with your physician or provider if you are considering making any changes or supplements. There's a lot of demand for quick foods now that we're all so busy, but there are a lot of really healthy quick foods that are available, whether that's frozen meals, things that are already cut and clean for you. And even when you are eating out, it is possible to make healthy choices. Consuming a lot of highly palatable ultra processed foods or sugary beverages. So that's something that you may want to consider making some swaps out, which I'll talk about a little bit. But we don't want to have most of our meals coming from these highly processed food items. Access to healthy foods. If you're struggling in your community to have access to nutritious foods, I would encourage you to, reach out to some local churches or food banks. We have a lot in my area in South Florida that can help people get access to really healthy foods. And your ability to cook, definitely look for things that are easy to cook. When you're eating healthy for diabetes, you do not by any means have to cook super fancy meals. Even if you can make basic things, that's still better than not trying at all. And we have to acknowledge diabetes burnout. And even with, kidney disease and heart disease, it's a lot to think about mentally. It can affect the way that you feel physically. So if you're experiencing diabetes burnout or some of these other emotions that come along with diabetes, depression, anxiety, shock, I really highly encourage you to reach out to a mental health care professional to talk about that because it is real and it is something that we need to acknowledge. So what are some of the current eating pattern recommendations when it comes to diabetes? Again, you do not have to give up carbohydrates for diabetes. It is recommended 40-50% of our overall caloric intake come from carbs, but we want to focus on those high fiber, minimally processed carb sources like whole grains, fruits, vegetables, beans, root, and starchy vegetables. 20-30% of your caloric intake coming from lean protein. And protein really helps you to feel full, helps slow down blood sugar spikes with meals. So it's really important to include some type of protein with every meal, whether that's plant-based proteins, chicken, fish, eggs, turkey, lean cuts of pork, or some beef. And then fat, 20-35% of your caloric intake coming from fat, really focusing on the monounsaturated fats, which are better for our heart, like olive oil, avocados, avocado oil, nuts, and seeds. Other recommendations, when you look at all the research that there is for diabetes and nutrition, a lot of commonalities are emphasizing the non-starchy vegetables. So having, whether they're cooked or raw, however you enjoy them, but making most of your meals those non-starchy vegetables or finding ways that you enjoy them is really important. Minimizing added sugars, especially in beverages, but also those really highly processed grains, and switching to more whole food items, more real foods, foods that are, minimally processed, maybe making more meals at home. but still including a variety of foods. Again, you don't have to cut out certain foods that you like or certain food groups just because you're trying to manage your blood sugars. Now, there is a lot of research to support, reducing overall carbohydrate intake during meals. And everyone is completely different with those recommendations. So I would recommend meeting with a dietitian on your specific recommendations. And some people with type 2 diabetes may need lower amount of carbohydrates, but you need to work with your doctor or registered dietitian on what is safe for you and your medications. Some nutrients that are really important to include, I've been talking about this a lot, but it's fiber. And that's because it's really great for your heart, lowers cholesterol, helps you feel full. It minimizes blood sugar spikes. And the goal is for most of your grains to be whole grains with high fiber, greater than 5 grams of fiber per serving, and a total of 25 to 38 grams of fiber per day. If you're not used to consuming that much fiber, I would recommend to increase it slowly. Otherwise, it can be kind of, you can experience some discomfort in your stomach. Magnesium is another important nutrient. Before doing any kind of supplements, it is important that you consult with your physician. But there is some evidence to show that higher magnesium can help improve insulin resistance and also reduce the risk of type 2 diabetes and metabolic syndrome. Vitamin D as well has been shown, vitamin D deficiency has been shown to increase rates of type 1 diabetes and insulin resistance. So adding some of these vitamin D rich foods into your meal plans may be a fun way to boost vitamin D. And again, talk to your doctor about any kind of supplementation. And then omega-3 fats, really important for heart health. They can reduce your risk of coronary artery disease and also lower your triglyceride levels. So the recommendation is at least 2 servings of some of these fatty fish a week, but you could also get these nutrients from walnuts, flax seeds, chia seeds, and soybeans as well. So the Mediterranean diet is really popular. There's been a lot of research around it for a lot of benefits, lowering blood sugars, lowering triglycerides, risk for a heart event, lowering fasting plasma glucose, and also reducing the risk of type 2 diabetes. And this diet is mainly comprised of whole grains, again, that fiber, the beans, the lentils, fruits and veggies, but also having more seafood versus meat in the diet, having more nuts and seeds, olive oil as the primary cooking source versus butter, and then some red wine is included in this diet if it's safe with your physician, but really limiting those sweets, processed foods, and fried foods. Now, the keto diet and low carb diets, they're very popular right now. People are always asking me about these diets, so I wanted to talk about them. A keto diet is a diet that is predominantly fat. So about 70% of your calories are coming from fat, 20% or less from protein, and then less than 25 grams per day of carbs. So it's very low carb. There are some benefits that we've seen in the research with weight loss, lower blood sugars, post meals, improved insulin sensitivity, and lower medication use, although more benefits have been shown in low carb diets that include more plants, fruits, and veggies. But the cons are, in some cases, it can increase your risk of kidney disease, especially for people that are consuming a lot of protein or think on a low carb diet they're supposed to consume a lot of protein. It can increase cholesterol levels. It can be dangerous for patients on certain medications that can cause hypoglycemia, like insulin. It's pretty restrictive diet. It's very hard to maintain for a long period of time. I don't know that it's realistic for most people. And with all of these conditions we're talking about, blood pressure, diabetes, heart disease, kidney disease, we're not necessarily looking for a quick fix, right? This is something that we're looking for long-term success and long-term health. And so going on a quick fix diet like keto may not be the answer for you. It can also lead to electrolyte imbalance as well. Now, some people will do the keto diet and intermittent fasting together, and that's basically a period of fasting in between eating. Can either be a few hours or up to a day. There has been research to show that this can improve weight loss and insulin sensitivity, but it can cause low blood sugars, dehydration, and risk of malnutrition, just lack of nutrients and protein intake. And it can be dangerous for certain people with different conditions or medications. And then some other eating styles to consider that have been shown to be beneficial are plant-based, vegetarian, vegan, or flexitarian, where you kind of combine some plant-based meals into your regular diet, which is really fun. That can improve A1C, weight loss, lower cholesterol, improve insulin sensitivity. Low-fat and very low-fat diets have been shown to help with weight loss. There is some mixed data with glucose improvements. Again, I think it's a pretty difficult diet to achieve, less than 10% of your calories coming from fat. And it's a really high fiber diet, which I think is difficult for most people to tolerate, but it can lower blood pressure, lower triglycerides, and improve your HDL levels. And then also the DASH diet, which is a lower sodium diet, minimally processed foods. It's been shown to improve A1C, blood pressure, cholesterol, and weight loss. So those are a lot of different things to consider. And I'm a big proponent of you don't have to choose a specific diet. It's important to choose what's going to work for you. You want to focus on a goal that is specific for you. So I always talk with my patients and my clients, on their goals, not their family, what is most important for you, and set up SMART goals so that you can actually achieve those goals, in small steps. And think about what's realistic for you, what's achievable for you. That's part of the SMART goal, right? Is it trying to have healthier cooking methods? Is it buying healthier groceries? Is it exercising twice a week? And remember, you don't have to change everything overnight. I usually work with my clients on adding more nutrients into their foods versus completely getting rid of all the foods that they enjoy. So that can be, more fun and more pleasurable in your eating experience. And sometimes switching, adding more, herbs, spices, garlic, acidity into your foods versus salt, butter, or frying, that can, again, increase that pleasure with your foods without feeling really restricted and still having yummy meals. And then pick an approach that works for you. Again, it could be maybe you like the flexitarian, maybe you like having more fish in your meals, maybe you just want to start with adding more meals at home. And then also there have been some studies that have showed lower glycemic index foods can improve glucose. So that would basically be higher fiber foods, and you can look up lower glycemic index foods, but really that glycemic load matters, the amount of carbs at one time. And then adding, again, these nutrients can help improve cholesterol, blood sugars, and A1C levels. So maybe just focusing on, again, those fatty fish or more magnesium foods like those green vegetables or nuts and seeds. That can be something beneficial for your blood sugars. Swapping out some of those ultra processed foods for real foods. I love doing this with my patients and my clients. So instead of things like chips and cookies, not to say you can never have those foods, but maybe swapping them for nuts or seeds, vegetables, fruit, and try carbohydrate counting, reading those labels to be aware of what's in your food. I know that we'll probably talk about this more on this conference with the fat and the salt, but just looking at your carbs, being aware of what they are, and making a food journal to really learn about your habits and what foods affect your body can be really helpful. Also to go over with a dietitian so we can see, how you're doing and what's working for you. These are just some of the resources, and I can always post these somewhere if someone wants to look at them later. But yeah, that is it for my presentation. I don't know if there are any questions. Let me stop sharing. Oh. Did it work? All right.
Does anyone have any questions? I believe
I-
Jonathan had a question. Go ahead, Bella. Go ahead, Bella.
I'm very sorry.
Yeah,
Yeah,
you're fine.
so I wanted to ask for someone who is dealing with diabetes, what would be considered a good daily caloric intake? I believe generally that will vary from male or female. However, I don't know if that's actually true with regard to when you're dealing with diabetes. So that's my question. What is a healthy daily caloric intake for diabetics?
Yeah, I think it's really going to depend on the individual and how active they are and also age. So it's such a big range depending, but what I like to do with a lot of my clients is sometimes just focus and break down those individual meals or, individual carb amounts, because sometimes when we're reducing the carb intake with each meal for better blood sugars, that can result in a better calorie intake if the person is looking to lose weight. Some of my patients are trying to gain weight, so I'll increase their calories. But yeah, it's a pretty broad spectrum. I think now we focus more on the carb counting versus the calories, and kind of go from there with our patients.
Thank you.
I have a
I
question
have a quick.
for
Okay. Who wants to?
diabetes diet mistakes.
Diabetes
Go ahead, Dr.
diet
Brooks.
mistakes. Oh, sorry.
Wait, you had a
Oh, I was going to ask her a question.
what these diet mistakes do you see newly diagnosed people with diabetes make?
Yeah, so some of the mistakes I see, like I kind of mentioned, are cutting out all the carbs or, kind of going online, doing a Google search and then saying, oh, this website said I can't eat this, this, this. I really enjoy them, but I just cut them out. So they may see improvements in the beginning as they're cutting out those foods, but then realizing, okay, either I'm really hungry or this isn't enough food, or I'm still struggling with my blood sugars, even though I cut these foods out, or how long can I really do this because this isn't enjoyable. These aren't the foods that I like to eat.
Mm-hmm. Mm-hmm. Yeah. So Jessica, I was going to ask you, what is among all the patients and clients that you've had, that you've taken care of, what do you find is the common thread, the common trait, the common thing that all of them do when they are successful, at staying the course, at lowering their blood sugar, achieving whatever goal that they wanted to achieve? What has been like that common thread among all of them?
Yeah, I think my patients that are the most successful really view the changes that they're making as a new lifestyle and a new way of life, because they want to feel good and they want to feel healthy forever, not just that quick fix diet. And they understand that, the little changes are better than no changes. And usually starting out small and tweaking a couple, one thing at a time can be more successful than kind of overhauling your whole lifestyle. And I also think, just following up and getting more support, because I'm sure we've all done this before, where you're really motivated to start something and you're really gung-ho, and then you kind of lose that motivation, or life happens, you get stressed. So coming in and getting that support when they need it. We have a lot of group classes, individual sessions. And so they kind of know, hey, I've been struggling. I need to meet with you again and go over some things again, just to keep it top of mind. That's really what I see with my most successful patients.
Awesome.
I have a question. I know people say, like on Friday nights, they're going out or birthday parties and they know, hey, I'm going to eat bad, or I'm going to binge. And what they would do, I've seen this, they would take the insulin shot prior to. So my question is that a good thing, or is that dangerous? Because I know I've seen it, and to me personally, I thought that was a dangerous thing, but I don't know. I mean, because the people that I see it's something that I see them do kind of often.
Yeah, I mean, definitely in those situations, like a party, a holiday, a get together, you can, some people, if they've been instructed with their physician, can change their insulin doses based on what they're eating. But even with that change in medication dose, it is dangerous to kind of say like, oh, now it's a free for all. You still want to have some type of planning going into that situation, whether it's, I'm going to really make sure to stay hydrated today, or I'm going to try to get some steps in and a walk in today so that I know I can have good blood sugars even if I am eating a little bit more, or can I create some type of balance at my meal, whatever the party is, or maybe bring something healthy to the party. And what I always tell my patients is try not to show up super, super hungry, because then you just want to eat everything. Everything sounds really, really good. So if you kind of have a strategy before the event, you can still go to the event, take your normal medication dose, and still have good blood sugars. It just takes practice, and it takes kind of, willing to learn and play around with it.
Thank you. Thank you.
I have a quick question.
Mhm.
You had mentioned small changes. Can you expand on that a little bit and define it just a little bit for us?
Yeah. So, when we're talking about diabetes, it can be a lot of things like lowering your carbs, adding more fiber, drinking water, going for walks, things like that. So sometimes with my patients, I'll just pick one thing that they want to focus on for whatever period of time they feel comfortable to get that down. So if they're feeling like I really want to try the walking because I haven't done that in a while and I really feel good when I walk, then I'll say, let's start with the walking and just go from there. When you feel more comfortable, then we can start, having maybe a lower carb breakfast. And then from there, how are you doing with the water? But if you try to set all those goals at one time, it's definitely overwhelming. And if you're not successful with all 10 goals that you set, sometimes you can feel like a failure. But really, if you nail down one or two things at a time, that's what really gets that momentum for success.
Excellent. Thank you.
I'd like to just share, I totally agree with that. I deal with type 2 diabetes, but I don't need maintenance with regard to medication, thank God. But it did take a lot of discipline. And so I started out with doing a little list of what are my greatest weaknesses, with regard to what I like to eat that I know is definitely not good for me. And like you mentioned, Jessica, the chips thing, which we can tend to indulge in when we're watching TV. And my weakness was carrot cake, and that is a definite no-no. So I started with that and kind of, gradually weaned myself, off those things. And, one thing I definitely will say is having diabetes and eating properly in relation to maintaining it is truly a lifestyle, but it can be done.
Yeah, thank you. That's so great for sharing. I think a lot of people can identify with that list. And when your sugars are high, you actually crave more of those foods. So sometimes you get stuck in this pattern. So really breaking it down step by step can be helpful.
Yes.
Would you agree that your mindset and your attitude plays a huge part in that?
Yeah, definitely. And we talk about this a lot in our group sessions with everyone sharing. But yeah, having that goal, what is your motivation, and knowing that you can be successful. I think sometimes we get overwhelmed with other people's opinions. This is too hard for me. This diet is the best. This is, not working. And you really want to focus on what feels good for you, what works for you. And just because that's someone else's story doesn't mean that has to be your story with diabetes.
All right. Well, Jessica, very much for that awesome presentation. We definitely appreciate it. You definitely joined us today. So, again, thank you for joining us. Next up, we have a commercial, Creamy Crack Body Cream.
Hi everyone, I'm Camille Cook, the family nurse practitioner, the creator, the developer, the chef, and the cook of crack. Well, Creamy Crack, the addictive, all-natural body cream. I have a background in dermatology and cosmetic surgery, and I created a 98% organic and a 2% all-natural body cream in 2011 for both my son and husband. My son, who suffered from the irritating symptoms of eczema, and my husband, who was a 2-time kidney transplant survivor and who was on kidney dialysis for over 10 years. They both suffered from the dry, itchy, scaly, and flaky skin. And as a mom and a wife, and with a background in dermatology as a nurse practitioner, I couldn't stand back and see them suffer any longer. So I got into the kitchen and started cooking crack. Well, Creamy Crack again, the all-natural body cream. It moisturizes, it replenishes, it restores, it heals and protects your largest organ. You got it, your skin. I have been able to make such a difference in the lives of those people who suffer from the irritating symptoms of being on kidney dialysis or who are awaiting a kidney transplant, and also for those who suffer from eczema. Those people or individuals have suffered way too long and tried too many things to help their skin come back to life. I am so honored and grateful for you to try this all-natural body cream. Again, that's going to help you look and feel better with your skin. Creamy Crack can be found on all social media platforms at Creamy Crack Body Cream, or it can be purchased at creamycrackbodycream.com. I look forward to serving you, sharing with you, and making an impact in your life. I hope you'll go out and try Creamy Crack, the addictive, all-natural body cream. Thank you.
Thank you, Ms. Cook, for that wonderful commercial. Next moderator up is Tim Jackson.
Hello, everybody. How you doing today?
Evening.
Let me get the screen going. All right. So today I have the privilege of introducing you somebody that's going to stress a little bit today. My name is Tim Jackson. I am the Blessed Podcast and creator of Built for This. That everything that happens to you, you can get through, and you were created better than you were yesterday. So my job is to introduce you. Came here to see. I'm going to introduce to you. Hold on, let me get up the bio. Dr. Alexandria Rosa, aka Dr. She's been in healthcare for almost 20 years, and she was working as a nurse educator, and worked at the bedside for various ICUs while she finished her doctoral degree in nursing. During those 20 years, 3 children, maintained a healthy, supportive marriage with her high school sweetheart, and served as her dad's caregiver. Holistic practitioner from Ohio. She specializes in women's health, hormones, and ending generational cycle of diabetes, high blood pressure, and obesity in minority. So introducing to you all today, Alex Rosa, and she's going to be talking about therapeutic, a holistic treatment option for diabetes management. Dr. Rosa, how are you today?
Fantastico. I'm doing great. How are you?
All right. So, Dr. Rosa, one of the things that you're going to talk about is managing our diet for those who may be battling with diabetes, and also this is good information for those who aren't. How a tweak in your lifestyle can make a in your life.
Yeah. Yeah. So thank you for that great intro. Thank you. Yeah. I'm going to be talking about, holistic treatment options for diabetes. And when I talk about diabetes, I'm specifically talking about type 2, right? Because our previous guest did an amazing job. There's type 1 and type 2. I'm going to be specifically speaking about type 2 and high blood pressure and some therapeutic things that we can do that are holistic, that are all natural, to help us manage those and to improve our lives, improve our health overall, because diabetes and high blood pressure can impact our lives. And what I do with nursing is, one thing always leads to another. So I know if somebody comes in with one thing, they're at a higher risk to develop another thing and another thing and another thing. So we need to put a stop to that. And why this topic is so important to me and why I love this conference and what everyone has put together and is presenting here today is, high blood pressure, diabetes, it is really ravaging minority populations. The ethnic community is really suffering with this. And it is such a fact. It is a fact that we are disproportionately affected by diabetes and high blood pressure, obesity, all those things. And as a result of that, we are succumbing to all the complications that come from all of that. Kidney disease, hello, my kidney trails familia, all of that. We are at such a high risk to develop all these other problems from that. And you can just look around in entire families and see exactly what I'm talking about. My family was no different. My entire family had type 2 diabetes, high blood pressure, strokes, amputations, all the things, all the complications that come from being diabetic, and poor lifestyle choices and education and our culture and our traditions and our religion. All of those things play such a huge part in our health and what we think about health, right? Not everybody thinks about what health is in the same way. What's healthy to one person is not healthy to another. And that generational cycle, it just keeps going and going, all those same ideas. And you only have to look at your childhood and think about what was talked about health when I grew up. What was considered healthy? What was I being fed? What was I eating? What was I doing for exercise? Were I even doing any exercise? All of those kinds of things. Even how we talked about our bodies and our mental health and our physical health, really taking it to that holistic level. Like, you really have to look at that. If you're really going to talk about health and improving people's health and their health outcomes, you got to get to that level. So much of that was just going back to my childhood and looking at it. And I knew from looking around me that where I was going to end up, what my future was going to be. I was going to be diabetic. I already had high blood pressure and was on a bunch of medications. I was already having problems with my kidneys, and I was like in my early 20s. And like, I have years and years and years of life ahead of me, but only if I make a change, if only I decide to do something about it to make the rest of my life be the best life that I could possibly live, to increase the quality of my life so I could be here with all of you and to teach and to share and to make an impact and to be here for my family and for those people that care about me. I knew I was going to have to make a change. And that's why I kind of relayed that question to our first speaker, because, there's one common trait. No matter what you do, whatever diet, whatever tip, whatever anybody shares today, what the biggest takeaway is, you got to pick one thing and you got to commit to it. You got to do it. You got to incorporate it into your entire life. You have to go all in. You have to make it a priority. You have to make yourself a priority, and you got to do it. You can't just pick a little of this and a little of that and join 10 different Facebook groups, one for high blood pressure, one for diabetes, one for this and one for that, and think that your life is going to change, because it's not. You got to make one choice, one decision for yourself and stick to it. And so I wanted to talk about one of the things that I like to teach about, one of the things that I use in my life. And I'm going to preface this by saying, you need to have a healthcare provider that you're working with. With any decision that you decide to make about your health, please be working with a healthcare provider, somebody who knows what is going on with you and your body and your medications. That's the first thing, okay? And so this is for educational purposes only. I'm not prescribing this for anybody. But I do want to share what has worked for me in my life and something that I do teach and that I do share to other people who want to improve their blood pressure, who want to get off of medications, who want to lower their blood sugars naturally, who want to increase their insulin resistance or increase their insulin sensitivity. Like our previous guest talked about, insulin resistance is such a huge problem, and that's really what is causing that type 2 diabetes. So the topic that I wanted to talk about today was intermittent fasting. And intermittent fasting, you can also call it therapeutic fasting, because that's really what it is. It is a therapeutic treatment meant to be overseen by somebody who knows health-wise what is going on with you. And so working with a healthcare provider, whether it's me or somebody else, that is really the way to go if you want to do this properly and really see those dramatic changes that intermittent fasting can provide for you if you so choose to try it. Like I said, you got to pick one thing and go all in and do it if you're really going to want to see those long-lasting results and stick to something. Like, you got to decide and prove to yourself that you can do this. You can break the cycle. You can defy the odds. Like I always say, you can do it, but you got to want it, and you got to decide, and you got to stick to one thing. Okay. So I'm going to talk about some natural ways to lower your blood sugar, which our first guest already did talk about. And it's no new information, right? You can find all of this, but are you going to do it? Are you going to decide to stick with it? So lowering your blood sugar naturally, you got to get rid of what is spiking that blood sugar. And that is all the refined carbohydrates, all the foods. If it comes in a box, a can, or through a window, honey, that is what is raising your blood sugar. You need to cut all of that out. And cutting that out is going to naturally help to lower your blood pressure as well. Just simply doing that, cutting back as much as you can, or not even doing it at all. Can you imagine not doing that at all? There's a lot of people that don't. But if you're really serious about something, you're going to do it. You're going to do it. So that is one of the ways to do that. And you can look up all the information about carbohydrates and refined. I'm not going to get into all of that. Our first guest did an amazing job at presenting all of that. But she's right. To lower your blood sugar naturally, you just need to get rid of all of that stuff. You don't need to be eating it. Okay. And then to go into the blood pressure, I talk a lot about holistic health, right? So everything that's going on with you spiritually, physically, emotionally. I talk about SPICE, which is spirit, your physical health, your insight, how your self-awareness and what you're doing with your life, your career wellness, because how many people are stressed out from their jobs and unhappy with their jobs? And that stress is what is slowly killing them, right? And our emotional health, okay? So I talk about all of those things in SPICE, and that's really why I developed that. And so I carry that with me into everything that I teach. So when I talk about intermittent fasting and I talk about lowering blood pressure naturally and lowering your blood sugar naturally, that is what I tie into it. So if we think about stress, that long-term chronic stress, that is really what is killing people, is that long-term chronic stress that puts your body under stress. And that is what is raising your blood sugar. That's raising your blood pressure. Okay. And it does a whole host of other bad things, chronic inflammation, all other types of things to your insides of your body. So looking for ways to naturally lower your stress is one of the biggest things that you can do. But we can use stress to our advantage. So there's good stress and there's bad stress. The bad stress is just what I talked about, that chronic long-term stress. That is going to stress your body out, and your adrenal glands, on your kidneys, that are the fight or flight ones that respond when a stressful situation. Those bad boys are getting worked overtime in people that are constantly stressed out. So we got to relieve that stress. You got to find ways to relieve that stress. That's a whole nother topic for a whole nother show, but that's one of the things you need to do. The other thing is looking at good stress. And good stress is just short, intermittent periods of time where we stress your body out. So some examples of this quickly are exercise, short-term bursts of stressing out your body, good for you. Athletes who do high altitude training, they deprive their bodies of oxygen. That's what happens naturally when you get up into those high altitudes. But athletes like to train up there, right? Because they can increase their stamina, increase their endurance, because they are purposefully depriving their body of oxygen for short periods of time. So it helps your body to change how it works and it becomes more efficient. And so they do this in the short term. This is type of good stress. Another one is intermittent fasting. Intermittent fasting is stressful on your body, but we use it intermittent. We use it short term. This activates so many amazing processes inside of your body that do some pretty magical things. So one of them is really to up your insulin sensitivity. So most people's bodies, we're just used to running around with all these high levels of insulin because we're constantly eating. We're constantly eating things that are high carbohydrate, and our body is just producing insulin all day long. Your body gets desensitized to that. Your body is just like, oh, I got all this insulin, I don't got to worry about it. It's just like with everything in life, right? If you're around it enough, you become numb to it. You don't notice it anymore. Same thing with your body. Your body's just numb to that insulin. So how do we reverse that? Well, we fast. We use therapeutic fasting. We deprive the body for short periods of times to increase the insulin sensitivity naturally. This is a good way of using stress to your advantage. So this ups your insulin sensitivity naturally, so that way you can start using insulin more efficiently and start to bring your blood sugars down. And it also helps with your blood pressure because you're going to naturally start to lose weight. That is naturally going to happen because your body is going to start to use the fuel that you have. Fuel meaning fat. And most of us have so much excess fuel on our bodies to use. So that is what your body is going to turn to use to keep itself running and humming and do all the things that it needs to do. And that's what you want. You want to tap into that. And you need to use intermittent fasting to safely and quickly get into those stores and do it in the right way. And that's why working with a provider during this process is really important, and doing some detailed micronutrient testing. That's another option that not a lot of people are aware of, but you can get very detailed micronutrient testing. You go to the lab, get your blood drawn, and they can see all the different vitamin and mineral levels in your body. I always add some general lab work onto there as well to see what everything else is doing. And it gives you such a bigger picture, more in-depth, accurate picture of what is actually happening inside your body, because no two people are alike. What works for one person does not necessarily mean it's going to work for another person. So really getting detailed, looking inside and seeing what's really happening while you're going through all of these changes and these processes, it's pretty amazing. But that is really a really amazing way to get very detailed and to use this to your advantage and use it as a natural treatment option for blood pressure and for type 2 diabetes. And I think that's kind of the end of what I want to say. I could go on and on, so I got to watch myself. But if anybody has any questions, I would be happy to answer them.
All right. Thank you. A few questions myself. First, let's get into some segments. Let's get into some. Jonathan said you're doing an awesome job, and he called you about Dr. Spice. So people out there watching and can't wait to hear what you're saying. Now, my first question is someone who's tried intermittent fasting. Does time of day make a difference? And what I mean by that is if I want to fast, do my fast hours first thing in the morning to midday. Is there any difference in that from fasting later in the afternoon just before bed?
So I'm going to say this. I like to tell people to leverage sleepy time as your fasting time because you're naturally asleep and you're not going to have to worry about it. Because probably the biggest challenge that you're going to come up against with intermittent fasting is the mental part, is I should be eating, I want to eat, I'm hungry, but you're not really hungry, but you're thinking you are. So leveraging that time when you're asleep, that's a good chunk of time. So leveraging that, and I always tell people to kind of, look at their individual schedule. And that's why working with somebody or really getting detailed into like, what does your schedule look like? Because that's going to impact it as well. Because if you can kind of leverage, I'm really busy during this time of the day, that probably would be a good time of day to kind of flow into your evening maybe and fast all of those hours. I know I'm usually busy all morning to the afternoon. So I push mine to like 12 or 2 o'clock in the afternoon. And so that works for me. But like, if you're a person that works night shift, like I used to work night shift as a nurse, like then your schedule is going to look entirely different. So leveraging that time around when you sleep, whether it's before or after, that I think is really going to be the sweet spot for people to kind of figure out what will work best for them. Does that help?
All right. Yes, that makes sense. That makes sense. Listen, that was really spicy. So we're gonna take a little break. We've got a commercial to come to you. We're gonna cool off, come back, get some water, and we've got for you if you don't mind.
Sure. Do you want me to go right into mines, or I didn't know if the screen was going to change or not? That's all that I'm I'm worried
We have
about.
another commercial coming up, and then when we come back,
Okay.
we will
Okay,
finish
I'm
with
sure.
questions, I believe.
Yeah, just let me know. So I guess it's time for my commercial. So I'm doing my commercial live. So again, my name is
Okay.
Dr. Oh, are we okay? Can I go? So my name is Dr. Alex. I'm a holistic practitioner from Ohio, and I am on a mission to transform healthcare and how it is delivered to you. I specialize in creating holistic experiences and programs for women, and one of them happens to be my 90-day metabolic makeover. So this program revolves all around using intermittent fasting to help your body to burn fuel faster, really how to ignite your metabolism at any age. I really find myself being drawn to working with women who are dealing with diabetes, whether it's pre-diabetes or type 2 diabetes, they've been diagnosed, whether they have high blood pressure, maybe they're dealing with PCOS, maybe it is some chronic inflammation or chronic fatigue. Pre-post menopause is also an area that I specialize in as well. So all of these areas really are impacted by metabolic syndrome, and not a lot of women really realize that they have metabolic syndrome, but it is that cluster, that umbrella term used to describe high blood pressure, high cholesterol, high triglycerides, inflammation, fatigue, the hormone imbalance, the mood swings, all of that, diabetes, type 2, that all falls under that metabolic syndrome. And those are really dysfunctions of your metabolic system. And there's ways that we can use to correct that. So I use intermittent fasting, I use detailed micronutrient testing, and all kinds of other really specialized things. But I always want to consider and do it in a holistic way. And my goal really is to end that generational cycle of diabetes, chronic diseases, high blood pressure, obesity for minority families, particularly for women, because we are so important part of the family. And I know that many of us are trying to do all the things and be all the things. I mean, I've been there. I have done all the things, and it's possible, and it's definitely possible to break that cycle and defy the odds, take control of your health, and make some big changes. So if you'd like to learn more about my program, just message me. Do not waste another minute. Send a message directly to me. You can find me on Facebook, LinkedIn, YouTube, Instagram. I'm on all the places. So feel free to reach out to me, and I can share with you more information about my program. And like I always say, for a balanced life, just add spice. That's my commercial.
All right. Hey, thank you, Dr. Rosa. Guys, make sure you go out and get your spice. So make sure you contact her and find out, how little changes can start to change your life. Things that I do, Dr. Rosa, is I teach people how to, do healthy habits in their lives. And it always starts with small changes that grow into big changes. So what's your advice for someone who sees this and decides they want to start getting into intermittent fasting? What are some tips that you?
The biggest tip, and again, what I went back to with Miss Jessica, is just pick something and do it, whether it's intermittent fasting or whatever it might be. Pick one thing and stick to it. Stay the course. That is such a downfall, because just as she said, people want such quick, fast results. That's not real life. That is not your life. That's not a life to live. So pick one thing and try it. The other thing is the one thing that I really do like about the intermittent fasting is that it does force you to be very intentional and be very committed to what you're doing. And you have to really be thinking about it. And so much of what we do is just mindless and habit. And that's kind of what's gotten us into trouble in the first place. So that would be my other thing, is just know that you're going to have to be very invested in what you're doing, and that you're going to need to, and again, going back, whatever you decide, you got to be focused on doing it. You can't half-ass it. You have to focus on it and do it if you want to see any real change. And you should not be messing around with your health. I think that should be the big takeaway from everybody. Don't mess around with your health, because you might not be here tomorrow. If you're going to decide, you got to decide today. Today should be the day that you decide to make a change in your life and go all in with it.
All right. We have a from Bella. Bella Langston, if you'd like to ask a question.
Yeah. Hi, Alex. So I loved your presentation and your commercial. I'm one of those people who loves the idea of doing anything pertaining to my health holistically and in a healthy way, if possible. So I have read up a little bit in the past on therapeutic fasting, but I think what one of my concerns would be is, and I kind of understand the concept of it, but I kind of wonder if that's really advisable for someone who is dealing with diabetes, in the sense that we have to eat meals on a regular basis. I know I do. I can't speak for every diabetic. I've got to have some breakfast. I've got to have some lunch. I've got to have some dinner. And for me, since I don't eat sweets, I have to have a little healthy snack maybe about 3 hours before bedtime. So that confuses me as to how I could have a lucrative relationship, so to speak, with intermittent fasting. And then also there's a little part too. Does intermittent fasting cause any type of side effects?
Yeah. So 2 great questions. So to go to your first question, I would say, is therapeutic fasting something that you even want to try? Because from what you've kind of described afterwards, with your personal experience of how you need to eat, maybe therapeutic fasting might not be your thing. So that's the other thing that I always put out there when I'm teaching about things is, I'm going to share my experience, my point of view, what I believe is out there. And I can't really, how do I want to say this? Because I'm not trying to be rude at all. That there is so much information out there for and against things. And so if somebody thinks that intermittent fasting is not going to work for them for whatever reason, they're going to tend to naturally gravitate to that type of information. Like, you'll find it, because there's proof and data out there to support both sides of any topic you could think about. So there definitely are pros and cons to intermittent fasting. So if you in particular, and just you, because just like you said, everybody's different. If you feel like I do need to eat, I know my body, which is a huge thing. Like, you got to know yourself. If I know that I need to eat like this, and this, then maybe intermittent fasting might not be right for me. And that's okay. That is totally fine. So that would be my first part to that. Second part is, yes, there definitely can be some cons, some not so great things that happen when you do first start to intermittent fast, because your body is starting to entirely change how it runs. And it's using things differently and trying to function differently. So there will be a little bit of not so great feelings, but there's things that you can do to supplement yourself, and things that we can do to really alleviate and soften some of those symptoms as you're going through that. Because I would say that going through those little bit of discomfort would be so much better than spending a lifetime on pills or insulin or anything else, or having to have some sort of catastrophic diagnosis of something else. So I always say the trade-off, like everything in healthcare, there's a risk versus benefit. So you just kind of do that. But as always, working with a healthcare provider, working with a professional, don't go this route alone is another thing that I would say. So thank you for your question.
Thank you.
Yeah.
And thank you, Dr. Rosa. That was our last question that we have. So again, any last words, Dr. Rosa, that you want to leave us with today?
I'll leave everybody with my favorite quote. My favorite quote is, start from wherever you are with whatever you've got. And that applies to anything in life. Start from wherever you are with whatever you've got. And so that's my favorite quote. That's what I live by. And I just tell people, don't wait. Start from wherever you are with whatever you got. That's it.
All right. That's a great way to end it. Thank you, Dr. Rosa, for letting me be your personal hype man today. And Philip, we'll kick it back to you.
I appreciate Dr. Rosa. Ex-moderator, Langston.
Okay. Well, hello, everyone. My name is Audrey Bella Langston, more lovingly known as Bella. I myself am a 17-and-a-half-year post-kidney transplant recipient, as well as a host of my own podcast on YouTube and Facebook called Bella's Hope for Healing. So please be sure to check it out. Being a type 2 diabetic myself, it's really an honor to hear all of you professionals share on it, but also to introduce to you our next guest speaker. She is a registered dietitian and board certified renal nutrition specialist. She began working with dialysis patients about 7 years ago, and she grew to love helping others with kidney disease. And we love people who love to help us. She loved helping them improve their health through food. And that's what we've been talking about this whole time, better eating. She started her own private practice in 2001, which focuses on helping those with early stage chronic kidney disease maintain a healthy renal function. So please welcome our next guest speaker, Miss Lindsay Ducharme. Hello, Lindsay.
Hi, Bella. Thank you so much for the introduction. Happy to be here. All right, so I am going to share my screen. Let's see. All right, can you guys see that?
Not me.
Second.
All right. There we go. Okay, so I am going to be presenting on nutrition for improving your blood pressure. So as Bella said, I'm a dietitian and I work with kidney disease. So I see high blood pressure in pretty much all my patients. So high blood pressure is a cause of kidney disease, and it's also a symptom of kidney disease. So it's very important for blood pressure management when you have CKD. So some of the objectives of this presentation are to what nutrients help control blood pressure, best food sources of these nutrients, and how to get enough of these nutrients in your diet. So I know a lot of you may have heard, if you have high blood pressure, just limit sodium. Well, there is a lot more to it than just limiting sodium. So today I'm going to be focusing on the nutrients that you need more of if you have high blood pressure. And that is potassium, magnesium, and calcium. So all of these nutrients work in combination to help relax our blood vessels. And that is what helps bring down our blood pressure. So many foods contain all three of these nutrients. And they've done studies on supplementing these nutrients individually, and the results are mixed. So you really want these nutrients in the form of food. Supplements may not necessarily help you if you have to reduce your blood pressure. So let's start off with potassium. So how much potassium should we be aiming for? Well, the RDA, which is the recommended daily allowance, is 4,700 milligrams. So that's a really high number. I always say try to aim for at least 3,500 milligrams per day. The average intake of potassium in US adults it's very low. It's less than 2,000 milligrams per day, which is basically like a potassium restriction. So as a general rule, we're not getting enough potassium. So even if you could try and up it a little bit, that will have some benefits for your blood pressure. So sources of potassium include fruits, vegetables, dairy, whole grains, nuts, seeds, beans, and legumes. So here are some foods that are especially high in potassium. So any fruit or vegetable is going to have potassium in it, but I want to point out these ones just because they are very, very rich in potassium. So if you want to achieve that higher potassium over the 3,500 milligrams that we're aiming for, it's a good idea to include a couple of these high potassium foods in your diet. So most people, when they think of high potassium foods, they'll think of bananas, avocados, oranges, potatoes, but as you can, lots of other foods that are excellent sources. Beet greens are super, super high. Half a cup of cooked greens has over 600 milligrams. Beans are also a very, very good source of potassium. And you can see there's also potassium in dairy. There is potassium in things like chicken, meat, seafood, but I like to focus more on the plant sources. And you'll see why in the next few slides. So the next nutrient we want to encourage for better blood pressure is magnesium. So the recommended amount is about 500 milligrams per day. Good sources of magnesium are dark leafy green vegetables, whole grains, low-fat dairy, beans and legumes, nuts and seeds. So you may notice some commonalities between the food sources high in potassium and magnesium. So these are some food sources that are especially rich in magnesium. So our dark leafy greens, great sources. Beans and legumes. If you do half a cup of mung beans or soybeans, you're getting half your magnesium right there. But I know these foods aren't as common. Even things like peanut butter have magnesium, black beans, cocoa powder. So dark chocolate would be giving you some magnesium. Low-fat dairy, it does have magnesium, not quite as much as these other sources, but every bit counts. And your whole grains. So especially buckwheat, very rich in magnesium, whole wheat flour. Okay. And calcium is the third nutrient that we're focusing on. The recommended amount is about 1,000 to 1,200 milligrams per day for adults. So you may be wondering, should I be taking calcium supplements to really get extra calcium? And supplementation, especially above this number, above the 1,200 milligrams, it really has no benefit in terms of controlling your blood pressure. And for some people, it may be harmful. excess calcium can actually, from the form of supplements, can lead to calcification of your arteries, which is basically like the hardening of your arteries, which we do not want. We want our arteries to stay nice and flexible. So sources of calcium, most people do realize that dairy is a great source. It's also found in some plant foods and canned fish with bones, because the bones have the calcium. And so here are some of the really great sources of calcium. So we have, especially low-fat yogurt, 1 cup has a really good amount. Your milk, your cheeses. It's always good to do low-fat just because you don't want to be getting too much of the saturated fat. So vegetables, collard greens, mustard greens, spinach, really a good source of calcium. And then you can see the canned salmon, excellent source. So beans, nuts, and seeds also have calcium, and these ones are on the higher end for calcium compared to the other beans and nuts and things. So even if you're not eating dairy, you can still get calcium from plant foods if you're eating a good variety and you're eating them in sufficient quantities. So putting it all together. So there is a diet called the DASH diet. This stands for the Dietary Approach to Stop Hypertension. It's basically an eating plan that encourages high intakes of fruits, vegetables, and really nutrient-dense foods. And how it helps to control hypertension is that this diet is providing adequate potassium, magnesium, and calcium. So this is just a basic guideline of what the DASH diet entails. So it recommends 6 to 8 servings per day of grains. And of course, we want the whole grains because like I said in the previous slides, you're getting more nutrients in the whole grains, especially magnesium. It does allow lean meat, fish, and poultry, but at 6 ounces or less. So it does really encourage you to be eating some of these plant proteins like the beans and the nuts, not just including meat at every meal. So vegetables, it recommends 4 to 5 servings per day. Same with fruits, 4 to 5 servings. So that is a lot of produce. So you'll see kind of how to incorporate these in the later slides. But you know, it's possible, but of course, echoing what other presenters have said, you really don't want to be making these changes all at once. You want to do it in a slow, sustained fashion. So in low-fat dairy, 2 to 3 servings per day. That's just to help make sure you're getting the calcium you need. Healthy fats and oils, 2 to 3 servings per day. So that's things like olive oil, avocado oil. You're getting healthy fats from nuts and seeds. So you want to do less of the butter and the fried foods. So it recommends nuts, seeds, beans, and legumes at least 4 to 5 servings per week. But I personally encourage daily just because of how nutrient-packed these foods are. And it does recommend limiting sweets to 5 or less servings per week. And for sodium, it recommends around 1,500 to 2,000. So depending on how severe someone's blood pressure is. And of course, these are just general guidelines and they're going to vary person to person. So here are some tips if you were to kind of adopt this style of eating. So one thing you could try is swapping refined grains for whole grains. So by refined grains, I mean like white flour, white bread, white rice. So just try adding some more of the whole grains, like instead of white bread, try wheat bread. Try incorporating some different whole wheat flour, buckwheat flour into your baking. Just simple swaps like that. So another tip is to slowly incorporate more fruits and vegetables into your diet. So I would recommend adding 1 extra serving of fruit or vegetable every couple days just to let your body get used to the extra fiber. So a serving of fruit would be like one medium fruit, like one apple, or it could be half a cup of pineapple or melon. Serving of vegetable would be 1 cup of leafy greens, or it would be half a cup of diced vegetable or like a canned or frozen vegetable. So cost is a big concern when people are adding more fruits and vegetables. They think, it's going to get expensive. I tell people all the time, don't worry about needing to buy frozen. Frozen can sometimes be more nutritious than the fresh. And for canned, there's so many options in the market for just regular no added salt canned vegetables. So that is way better than not having the vegetable at all. And don't feel like you have to buy the organic fruits and vegetables, although some people prefer them. They're really not going to be much different nutrient wise. So just shop for produce that are in season that'll be a little bit more affordable. Check your groceries flyer and see what's on sale that week and plan your meals around that. So tip number 3, try upgrading your greens. So as I mentioned on the previous slide, the dark leafy greens are packed with nutrients. They have a lot of magnesium, calcium, and potassium. So you're getting more bang for your buck when you're buying the dark leafy greens compared to like regular lettuce. So another tip, try including a healthy snack into your day. So instead of reaching for the processed snack food, the chips, the little snack bars, try to do something with some sort of like fresh or whole food component. Like you could make your own trail mix with some nuts, raisins, even throw in a few chocolate chips. You could do like a yogurt parfait, top it with some chia seeds. You could do some cut up vegetables with hummus. Just having one snack with fresh foods rather than processed can make a big difference. And tip 5, try to have more meatless meals. So beans and legumes, these plant proteins, they have so many benefits to them. So there's so many meatless meals that, you may already be having, like pasta, for instance. That's so easy to make meatless. Instead of adding ground beef to the sauce, try adding lentils. It's actually really good, and it's way more nutritious because you're getting all kinds of magnesium and potassium in the lentils that the meat wouldn't necessarily provide. And you could try having like a black bean burger instead of a beef or turkey burger. Stir fries are super easy to make meatless. You could use edamame or some cashews as a plant protein, and it's easy to throw in like whatever vegetables you have on hand. So those are just some ideas. And this is a sample meal plan for someone who would be doing the DASH diet for a day. So as you can see, this is a lot of food. So you're having your breakfast, lunch, dinner, and 2 snacks. And I kind of broke down how many servings of each food. So there's 6 servings of grains in here, 6 servings of vegetables, 4 servings of fruit, 2 servings of dairy, 1 serving of meat, and then we have some beans and legumes and oils. So in order to get the amount of fruits and vegetables that the DASH diet recommends, you really need to be consciously choosing a fruit or vegetable at every meal. So, and including them in snacks is really, the only way you're going to achieve those high numbers. So in summary, improving blood pressure with nutrition goes beyond just a low sodium diet. So you really want to focus on getting enough of other nutrients like potassium, magnesium, and calcium from food, because these nutrients are going to work together to help regulate your blood pressure. And you want to base your daily eating pattern around more of these plant-based whole food items like fruits, vegetables, whole grains, nuts, beans. And as others were saying, you want to start making small healthy swaps that you can sustain. You're not going to go from eating 2 servings of vegetables a day to eating 6 a day in a week. It's going to take time. It's going to take a couple weeks, and making changes too fast usually backfires on people. So just, incorporate what you think is realistic for you. All right, so that concludes my presentation. If you want to learn more about achieving a healthy blood pressure through nutrition, here are my contacts. So feel free to reach out to me with any questions. All right.
I have a question for you, Lindsay. Being a transplant recipient, and I'm sure the rest of my transplant family on here may have possibly been told this as well. This is in relation to potassium. I remember when I was diagnosed, and as my illness started to get to a more progressive, a little bit more of a progressive, actually early on, when you're first diagnosed, or at least when I was showing very high levels of potassium content, as well as a few other things that needed to, be addressed right away. And I know that one of the main things regarding that was not good, which I had to be put on some type of I had to cut way back on potassium, foods that were high in potassium, and even temporarily put on like a little binder. Because of the fact, that I was told oftentimes they can cause, high potassium levels can cause heart attacks. And the really scary part was the fact that when I studied up on it, often it can show absolutely no warning signs at all. So that pretty much freaked me out a little bit. But at any rate, I did cut back on certain things that were very high in potassium that I did like. When I was with my trainer, I know weight training, legs, all that stuff, I would get leg cramps really bad, as we call them, the good old Charlie horse. And oftentimes it was due to if my workout was a little bit too aggressive. So what I wanted to know is, when that happens, a lot of people suffer from that either because of workouts or some type of health issue. What's best or most beneficial that they can eat to get that safely, get that potassium level back up? Such as like a banana. I know I had to cut out bananas back then because they said, no, those are too high in potassium, or is it better to drink some type of electrolyte beverage? And especially if a person is a diabetic, being careful about, what they're taking in.
Yeah, definitely very valid points about, people with kidney disease. So sometimes their potassium does run high, and you do not want to be loading your diet with potassium if that's you, because that could definitely be extremely dangerous. However, not everyone with kidney disease has high potassium. So you really have to go based on your labs and, talk to your medical team about, how much potassium am I allowed? So that's definitely an important step. So there is a form of potassium, well, a couple forms that is man-made. So that would be the supplement form of potassium, which is actually sometimes added to foods. So those electrolyte drinks, they have the additive form of potassium. It's also added to potassium salts are added to a lot of things like soups and other low sodium foods because it tastes like salt, but it doesn't contain sodium. It is high in potassium. So that form of potassium is especially dangerous for people that have issues with high potassium because it's very, very easily absorbed into your gut and more likely to bring up your serum potassium. The potassium found naturally in foods, especially like the fibrous foods like beans, they've done studies where your body doesn't necessarily absorb all that potassium because of the fiber content of the food. So it can be more safe for people that are a little bit worried about having high potassium. It's very individual. So I usually recommend, I like for people to kind of track how much potassium they're taking in. So you can use some sort of food tracking app like Chronometer or MyFitnessPal to kind of get a baseline of how much potassium you're consuming. And then you can pinpoint, where is a lot of my potassium coming from. So if it's coming from like something processed, like a canned soup or a drink, those are things that I would definitely have people eliminate, because it's much better to be getting the potassium from the fruits and the vegetables and beans and things like that. But there are medicines out there, like you were saying about the binder. So the good thing about the potassium binder is it allows people to have a little bit more flexibility, so they can safely have these high potassium fruits and vegetables that would really benefit them. So hopefully that kind of answered your question.
Yeah, it did. It did. And so in the event of, again, like if someone were to have a severe, something that kind of happens, I know if leg cramping happens often, you definitely need to see a doctor. But when you're working out, and I'm sure Tafaro has experienced this too, as well as many of his people that he's trained, is it, as far as what can give you that level of potassium with expedience, would that be an electrolyte drink? Or, because my trainer used to eat bananas like all the time because of that.
Yeah. It really depends on how strict you have to be, but I'm not sure. I'm sure a drink would definitely get the potassium in you quicker, and they're not as high. If you look at the milligrams wise, something like Gatorade, it doesn't have as much potassium as a banana, but I usually tend to have people shy away from those sports drinks, and I'd rather them even have like half a banana, and just focus on also like proper hydration, making sure you're not having too much salt, because really you want, some people consume more sodium than potassium, and that imbalance is not going to be good for their body. But I don't know if there's one specific food. Just encouraging lower potassium fruits and vegetables is also going to be a good option, because you're getting, magnesium and other things from these vegetables and fruits as well.
Gotcha. Thank you so much.
You're welcome.
Are there any other? A commercial from the Premier Strong Foundation. One second. Not playing. right. Well, Mr. Fred Hill, take it over, sir. Are you on mute? Or am I on mute?
I'm on mute. Thank you. I do apologize. I'll start over again. Listen, everyone, I'm Fred Hill. It's good to be here today. Thank you for having me. Excited to be here today. I am a kidney transplant recipient, also the author of Dialysis is Not Your Life. All because you have dialysis, I have kidney disease, does not mean your life is over. You can live your life big, and out loud. Available on Amazon.com. But listen, I'm not here about me. I'm here as a moderator today and excited to be here today. And I'm introducing Dr. Sharika Brookins. Sharika Brookins, MD, FASN, is a board certified nephrologist and internist licensed in Georgia. Dr. Brookins graduated from McHenry Medical College with a doctorate of medicine. She went on to complete her internal medicine residency training in her hometown at UF Health Jacksonville. After completing her nephrology fellowship training at Vanderbilt University, she relocated to Augusta, Georgia. She is devoted to community service by educating and empowering others about kidney disease, nutrition, transplantation, and health disparities. Dr. Brookins is the founder and CEO of Remote Renal Care, a telehealth kidney practice providing care to rural Georgia. Dr. Brookins is a published author in medical scientific journals and digital media, and a member of leading medical societies. Welcome, Dr. Brookins. How are you doing today? How are you doing?
Hello, good evening, Mr. Fred Hill. Thanks for that introduction. Thank you to the trio for having me again. It's always a pleasure to be here with you all and to share with your community.
Well, I tell you, we are excited and glad to have you here today. We're going to go ahead and get started because what we're going to talk about are the most frequent questions asked about high blood pressure. So I'm going to go ahead and start with the first question. Okay. What causes high blood pressure?
All right. So it's a very extensive question because there are a variety of causes of high blood pressure. But I will say the most common cause is going to be diet related. That's the most common cause that we see in America. So when we set out to not only categorize how to diagnose high blood pressure, but also how to prevent it and also how to manage and treat it, it depends on, well, is it considered a primary cause? Is it primary hypertension or is it secondary hypertension? So in the primary hypertension category, it's what most Americans fall under, and that can be due to obesity. It can be to family history as well as diet related. Now we have some secondary causes of high blood pressure. So as a nephrologist, we're also high blood pressure specialists, but most of the times we are sent those patients who fall under the secondary causes category because, again, if you're in that primary category, if it's obesity, the strong recommendation is weight loss and weight management and nutrition adherence or adjustment. If it's family history, unfortunately, we can't do anything about our genes. However, we can do the best with our nutrition and our lifestyle to adjust how we can. And then, of course, if it's diet related, it's seeing a nutritionist, a dietitian, as well as physical lifestyle changes. So in the secondary causes, those tend to run the gamut, starting from kidney disease. And actually, Lindsay had mentioned this cycle of chronic kidney disease and high blood pressure. It's a cycle, right? So high blood pressure can cause chronic kidney disease, and then chronic kidney disease can cause high blood pressure. So we all know The top two causes of kidney disease are diabetes and high blood pressure. And I remember decades ago, it used to be reversed, where high blood pressure used to be leading and diabetes was number two. But now, not now as in recently, but now we have diabetes is number one and high blood pressure is number two. So that's going to be the most common form of high blood pressure in America is primary, or what we call essential hypertension. And then we have a long list of secondary causes, which in the field of nephrology, we investigate those with further tests and studies.
Okay, thank you. So let me ask this question. I kind of wrote this one down, but what are the signs of high blood pressure? Because I know in the Black community, many of us, we actually have high blood pressure and don't even know it, not recognizing the signs.
Mm-hmm. Well, kind of like I call kidney disease a silent disease because we all know that it is, right? You don't get those symptoms until the later stages, but we know that high blood pressure it's known as a silent disease. So generally when someone has high blood pressure, they may not have symptoms of high blood pressure until it's too late. But I will say when they are in the later stages, the same things that high blood pressure is a risk factor for, we have heart disease. So sometimes it could be someone knowing that they have high blood pressure once they have a heart attack.
Wow. Okay.
Or it could be dementia. We have vascular dementia, which is where we start to notice memory loss. And once the brain is scanned, we notice that there's concern for vascular hypertension in the brain. Kidney disease. So although we don't have a lot of symptoms with high blood pressure, of course, there could be vision loss, but vision loss could mean a variety of things, right? You could have blurred vision from uncontrolled diabetes, or you could have blurred vision from just simple ocular diseases. But it is also a potential symptom to watch for with high blood pressure, headaches. But again, these are things that can come from a variety of different causes. So that's one of the reasons it is important to listen to your body. So even any little thing that you notice your body is experiencing, just always listen to your body. One thing I tell my patients is if you're having shortness of breath, if you're having chest pain, if you're having headaches that just won't go away, definitely changes to your vision, check your blood pressure at home. So I have my machine here, but I encourage everyone to arm yourself with a device at home.
Okay.
One of the things that we know, and it's been promoted over the last maybe 5 years or so, is that home blood pressure monitoring is more reliable than what we receive in the clinic. Wow. So now it's being said that if you have an in-office visit, we already do not diagnose off of one reading. So if you're ever in a clinic and you have one high reading, that is not a diagnosis of high blood pressure. It has to be more than one visit in which you have high elevated blood pressure before you receive the diagnosis. But it is also now encouraged that if someone has high readings in your office, to allow them to check their blood pressure at home to confirm and to prove that it is truly high blood pressure. And it's based on that we're going to proceed with, well, what's the next step with management and treatment? So again, if you have the headaches, check your blood pressure at home. If you have changes to your vision.
Go ahead. Don't let me cut you off. Go ahead.
Oh, no, I was just going to run back those common things, but although they could be a result of anything, but always, I just encourage you to check your blood pressure at home. These devices can run between $30 to $40. Mine is the most simplest version, and they even come cheaper than that. And insurance covers for devices as well.
Okay, so if you have one at home, how often I'm just ask this question. How often should you check it? Is it should you check it after a meal or before or after your medication, or is there like the morning, noon, and evening times where you check it for your blood pressure?
Okay, great question. And I'm going to start out with giving this disclaimer. This is also the reason why you should check it at home, is because sometimes in the office, there's operator error, right? You have patients come into the clinic. You've either had a long drive if you're coming from out of town, you have parking, you have waiting room, frustration, and they just sit you down and check you right away, right? So the number one thing is you sit with both feet flat on the floor. You do not cross your legs. You do not cross your ankles or anything. You want to be in a lowly lit room. So like, somewhat of a dim lit room, and you want to rest for a couple of minutes before you check yourself, preferably on your left arm, and you want your arm to be at the height of your heart. And so ideally, when we're trying to determine if someone is truly hypertensive, so this is what I do with my new patients, especially my new patients who come to me and they're already on like 3 meds and 4 meds, because my first thing is we're going to get you off these meds.
Awesome.
You need to check your pressure twice in the morning or twice during the day, and then twice at night. We're going to do that for 5 to 7 days. And that log is what's going to allow me to see, are you truly hypertensive? So if they've had these elevated pressures at previous doctor's offices and they're on these medicines, but then they check it at home twice in the day. So let's say 8 o'clock, 10 o'clock, or 8 o'clock, 12 o'clock. And then you do maybe a 5 o'clock, 9 o'clock. And it's been normal for a week, then what we're going to start doing is start bringing off some of these medicines and see how you do on less therapy. All right. Now, outside of that, on average, I would just advise once a day. But I do like to get a better picture because, for instance, let's say someone's hypertensive and their readings are higher at night, then we know how to adjust their therapy at night, or we know how to adjust their therapy during the day. So that's why it's good to get that baseline of having you checked in the daytime and the nighttime.
That was good. That was because I checked mine, but I think I don't have my feet down all the time. Sometimes I cross my legs. So I appreciate you sharing that. The next question is like when reading your the numbers, the 120, 120 over 80. When you're reading that, can you break down the systolic, the systolic and the diastolic? Could you break that down to of what are we seeing, or what we can get a better understanding of that?
Right. So with the blood pressure, there's 2 numbers. There's systolic, diastolic, or I call them the top and the bottom. So it depends on, like on my machine, it's going to show the top and the bottom, but it also says systolic, diastolic. So the systolic number represents, so imagine like your heartbeat, right? So when your heartbeat, it squeezes and it relaxes. It squeezes and it relaxes. And that's where you get the lub-dub sound of your heart. It boom, boom. Like this is what your heart is doing. So when your heart squeezes, blood goes out of your heart into the different vessels of your body. But the pressure that is in those blood vessels is the pressure that your heart is fighting against to push that blood out. So imagine like a water hose. And if you step on you have the water off, you step on a water hose and then you turn the spigot on, right? That's the pressure from your foot is what the water coming from the spigot has to deal with, the pressure that's from your foot. So every contraction, that number, and that's why it's the highest number, every contraction of your heart is that pressure that your vessels are experiencing when the blood goes out. And then the second number is when your heart relaxes. So that's why that number is always lower, because there isn't, your heart is relaxing. So it's not actually pushing blood out into your vessels. So your systolic number is always going to be higher than your diastolic number. If there's ever a chance where your diastolic is higher than a systolic, recheck it.
Okay. Well, I guess you just answered my question, because I know I've had people say, well, my bottom number was off, but my top number was good, so I'm good. This, so seeing what you're saying, pressure uh, versus the being relaxed. So
Mhm.
I got a question when you're looking at the reading. So when you're looking at someone like my size being 230 pounds, and someone like your size is like 125 pounds. And I always, they always say your blood pressure reading should be 120 over 80. So it does, because I've heard people say, I'm a big guy, so I should have a higher blood pressure than someone that is smaller. And so I guess, I don't know, is that a myth? Or when you're looking at that, should blood pressure vary according to the size of the person, or should it be the same?
No, so there's no data that shows that it should be different. Any and every blood pressure study, we have the same set guidelines, which is why we have a universal guideline when it comes to blood pressure readings. Like, you don't see women's blood pressure should be less than a man's blood pressure. Children are different because not only their body surface or their size is a lot smaller, but you also have to consider their vasculature. But just because someone is taller doesn't mean their blood pressure should be higher. And I think this is it's a good myth to address, because you don't want to walk around thinking that, oh, I'm fine because I'm taller, or I'm fine because I'm bigger. 150 is okay. Because at the end of the day, that still describes a lot of pressure that your blood is having to force against to get out. And actually, prior to 2017, high blood pressure used to be defined as anything above 140 over 90.
Yeah.
But they recently changed the guidelines to now where high blood pressure is defined as anything over 130 over 80.
Wow. That's good. That's good news to know. Wow.
Us through, whether that is an attempt to get people to kind of think, hey, let me get it lower, or whether it's through the studies of seeing, well, when the blood pressure is lower than that, people to do a little bit better, so for a lower goal. But high blood pressure used to be defined at 140 over 90. Now it's 130 over 80.
Oh,
that's for
good.
everyone.
That's good. That is really good. So let me ask this. So I know you said kidney disease, but are there any other diseases that are associated with high blood pressure?
Yes, it's like over 10 diseases, but I can start from head to toe, right?
Wow.
Strokes.
Mm-hmm.
You can have strokes from high blood pressure. You can have vision loss. You can have hearing changes. You can have fluid buildup in your lungs. You can have heart attack. For pregnant women, we can have preeclampsia. For men, you can develop erectile dysfunction. You can have leg swelling. There is, there are a variety of things, and of course, kidney disease. But those are just a short list of how high blood pressure, wherever there's a vessel,
mm-hmm.
There's potential to be affected.
That's good. That's good.
Wherever there's a blood vessel.
Wherever there is one. I like that.
Wherever there is a blood vessel, you can run the risk of, like, for instance, with diabetes is considered microvascular disease. So that means wherever you have, like we started our aorta, which is a huge vessel, and then it branches down to medium vessels to very small vessels. And then, diabetes more commonly, that's why it affects a lot of smaller organs, because it's a microvascular disease. That's why it affects the eyes. That's why it affects the nerve endings. That's why it affects the kidneys, because it's a microvascular disease.
Oh, wow. So let me ask this then. What are some treatments for high blood pressure?
So going back to the cause, when it comes to primary causes, Lindsay discussed a few where you can increase potassium, increase magnesium, and decrease salt. Those are going to be some natural ways just through your diet. And when it comes to medical ways, we have maybe about 4 to 5 different categories of therapies, but they're all targeting different mechanisms and different hormones. So when it comes to the kidneys, your kidneys is a main factor in developing high blood pressure through the use of hormones. So things like ACE inhibitors, right? That's the overall group. You'll hear angiotensin converting enzyme, which is ACE. So lisinopril, fosinopril, enalapril, those, what they do is they target that enzyme. And then you have losartan, valsartan. Those are a different group of drugs that affect a different enzyme. And then you have what we call beta blockers. So labetalol, carvedilol, those affect a different enzyme that also has a connection to the heart. And then you have water pills. And even the water pills, there's different categories, right? There's the water pill that's a strong water pill, the water pill that's a weak water pill, the water pill that will make you lose potassium, a water pill that'll make you keep potassium. So it really depends on not only what the cause of the high blood pressure is, but what are some other underlying issues that the patient is dealing with that determines the therapy. Generally, the rule of thumb is to start with a water pill because, again, the thought is, oh, well, people are eating too much salt. That's the common reason. So you give them the water pill. The way you lose the water is it pees out the salt. So that's how you lose the water, because it pees out the salt. So that's why that's one of the most common drugs that's started. Now, when you have kidney disease, we commonly start patients on lisinopril because studies showed that, if you had someone with diabetes and kidney disease, this pill will make their kidneys last twice as long. So that's why we always ran to lisinopril or that group of drugs. So there's a variety of treatments. There are also some studies have looked at some natural forms of treatment or some dietary supplements that have actually shown to lower blood pressure. And even for those who have sleep apnea, wearing your machine will help to lower your blood pressure.
Wow. Okay. Well, Bella had a question. She has a question for you, Bella.
Okay.
Unmute myself. Yeah, Dr. Sharika, hi. Thank you. You've been given some great input. I have a few questions for you. My first one is, oftentimes many people can get a dual blood pressure reading. One will say one thing on the left arm and the right arm will give a different reading. I don't think that's a normal thing, but is it a means for concern if that other reading is, and the machine isn't malfunctioning in any way, that other reading is significantly higher than the left arm, and is in fact the left arm the preferred arm to actually take your blood pressure on?
Yes. So if it is a significant difference, yes, that is of concern. So your heart is on the left side, and out of your heart comes the largest vessel in your body, the aorta. So one of the reasons we check the blood pressure on that side is because of the proximity to the heart. So your left arm is preferred. However, if you notice you check your left arm and then you check your right arm and then it's slightly off, then you can probably just pick a preference to use. And so, for instance, for patients who have fistulas on the left, we have to use the right, right? And so we just go based off of that. Now, if you check your right, and your right is like 120/60, which is good. And then you check your left, and then it's like 160/something, that is of concern, and there's a condition associated with that. So that's one of the reasons someone would get sent to a nephrologist, right? Because the primary care doctor would say, well, something isn't right about this. And what we do is we scan, and there's a condition in the heart that leads to that. So that person would then be sent to a surgeon to see if there's an indication to fix it. But in the meantime, we'll use the right arm. And it's the same with the limbs. So if we notice that someone is off like that, we also check the lower extremities too. And if it's off, this is a secondary cause. So remember, the primary causes are going to be your diet, nutrition, obesity, family history. But when you have something structurally going on, that's a secondary cause, and therefore every blood pressure pill may not help. That's another thing. If you're on therapy and you take your medicines as prescribed, and you're doing your best with your diet, but your blood pressure is still not controlled, you need to be evaluated for secondary causes.
Yeah. That's good.
Wow. Yeah. Okay. And then my second question was, aside from the obvious of genetics being a great factor, has medical science yet gotten any closer to figuring out why African Americans and Hispanics are more likely to suffer from hypertension and chronic kidney disease?
I will say that there is a fair amount of data out there that talks about salt sensitivity. And so we do know that Blacks in particular suffer from salt sensitivity. So that means if I take in 2,300 is what's recommended a day. 2,300 milligrams of salt is what's recommended. Mm-hmm. But if I take in 1,000, my blood pressure may shoot up compared to if someone who's non-Black takes in 1,000. And, the research is showing that we tend to be more salt sensitive. So that's why adjusting the salt in our diet would also make a profound impact on us. But of course, depending on how we're raised, depending on how the food is prepared, we love those smoked neck bones and our greens, it's hard. Our palate is just so used to that. So it is hard. It's a mindset of you have to switch up with herbs and different spices with what you use. But we do know that Blacks in particular are more salt sensitive. Now, when it comes to minorities in general, we do have to also consider certain communities in which people come from, whether it be their food access, right? So if they don't have access to those foods or better options, right? Or they may not have that knowledge or education to know how to adapt and swap out things, then it's a cycle within our community, right? Like every Sunday, this is just what we eat every Sunday. So that's one of the factors I would say is demographically just maybe our communities. Also, you have certain socioeconomic standards, but genetically, we do know that Blacks are more salt sensitive.
Mm-hmm. Thank you. Thank you so much.
I have another question. Are there any medications that we take? Can medications cause high blood pressure?
Yes. And I'll start with the most common culprit are going to be NSAIDs, so non-steroidal anti-inflammatory drugs, ibuprofen, Advil. So remember I said with high blood pressure or with kidney disease, there's a hormone that is stimulated by our kidney, and that hormone is impacted by the non-steroidal anti-inflammatories. So when you take those drugs, they affect the hormone, which then affects the blood pressure. But that's an easy fix, right? You just pull that drug away. But then we also have certain cough suppressants that contain certain chemicals that raise our blood pressure. So they have made a few on the market that do not contain those ingredients. So they are considered more heart safe. Mm-hmm. And it's no longer on the market, but like the weight loss drugs that contain ephedra. So that was a drug that we knew caused a lot of high blood pressure. And other than that, there are some other herbs that I will that I like to tell my patients, whenever herbs, vitamins, minerals, supplements, those are not harmful things to take. You just let me know about them so we can make sure there's no cross reactivity in what you're already taking, and that there's no known side effects on the kidneys, because there are some therapies that can damage the kidney. And remember that cycle, if it damages the kidney, you're going to have high blood pressure as a result of the kidney disease.
Okay, this is my last questions, because the last question you was talking about if you're taking supplements and those different things. So I'm a kind of open up about my family. So I know my grandmother and aunts and all of that. So I want to talk about the myths of myth remedies for high blood pressure. So like, the vinegar. My grandma she would take vinegar and say, well, I don't need to take high blood pressure today. I'm gonna drink some vinegar. She would drink this something called yellow root water. So she would get this yellow root and put it in the water, and she would drink that and say, well, I don't need to take blood pressure medicine, I'm just gonna fix it. My aunt, she put ginger root in everything. And she says that this right here is gonna stop me from having high blood pressure. And so to me, now, me personally, I guess I've never heard of the other things, the yellow root and the ginger root, but I've heard of the vinegar from the whole Black community in which I grew up in. So can you just, is it real? Is it a myth? Does it work? Should we fight against it or what? Can you kind of talk about that a little bit?
I will echo the sentiments of the previous speaker who stated there's going to be information out on the internet that will fight for certain supplements and information against certain supplements. Now, whether, where you're getting it from and the source being reliable is very important. So I welcome information like that, right? Like my patients text me, and if ever there's anything, you send me a picture or you send me the name of it, and we're going to look up and research it together. So when you mentioned yellow root, that one has never been presented to me before. I have been asked about golden seal root. And now golden seal root does not have a direct impact on high blood pressure, but studies have shown that it can have a diuretic component, which is right. That's a class of a blood pressure medicine. So it may not be a direct impact that we know, but it could potentially, right? But I always warn against that if you're someone who is dehydrated, because then you don't want to take golden seal root and pee a lot and you don't replenish yourself, because then you'll suffer from acute kidney injury, possibly ending up with chronic kidney disease. Apple cider vinegar, I will say, is one that I do not fight against that one. If it doesn't harm you, then take it. Take your teaspoon, your capsule full, however you take it. It's not harmful. Let me say that. But I mean, I have patients who take it and they're still on blood pressure meds. So, I mean, that I will say it's not a remedy, but it may make them feel good. So as long as it's not harmful. And then the other one you mentioned, ginger. Now, I will say I've seen more data on ginger with diabetes and weight loss than high blood pressure. But again, we know that they're all linked. So there's probably some indirect way in which the ginger root can help. Again, it's not harmful. So it's one of those things where as long as it doesn't harm the kidneys, I always say, travel at your own risk with it. But it's not as strong. Now, I will say some strong dietary supplements that have been studied is garlic. So there are a ton of studies that have shown effectively. And anything that can lower your systolic or your diastolic by 3 to 5 points is considered a good impact. And garlic has been shown to do by that and more in those with high blood pressure, as well as fish oil. Fish oil has been studied and shown to lower systolic and diastolic, as well as CoQ10 and probiotics. So those are some of the key things that I will say I have seen studies and repeatedly communicate with my patients about, that those are not harmful. I will say when it comes to CoQ10 and ginger, also like when Lindsay was mentioning the dark green leafy vegetables, if you're on a blood thinner, you have to be careful. You have to be careful about garlic. You have to be careful about CoQ10 and the dark green leafy vegetables if you're on a blood thinner.
Okay. Well, I tell you, I don't have any. I went through a whole lot. I don't see any more questions in the chat. Does anyone have any more questions? If not,
good call. Jonathan says he checks twice his blood pressure 2 times a day, morning and evening. And I do want to add, if you had to pick, check it in the evening if you have kidney disease. I mean, if you had to choose, because we know that in the evenings, your blood pressure should not be higher than in the morning. So we call it dipping. And so your blood pressure should dip in the evenings. And when it doesn't dip, we know that that's a strong risk factor for people to develop ESRD, like to develop worsening kidney function. So definitely, I always like to get a baseline of, well, what do you do at night? What does your blood pressure do at night? Of course, it's easier to remember to check it in the morning when you take your meds, but just to get an idea of yourself, kind of like, Tafaro, when he's making his exercise regimens, people want to get an idea of what their body can tolerate, or a dietitian, get an idea of where you're starting, is to get an idea of what your blood pressure does baseline before we start any implementation. My first visits are an hour, and we're always honing in on nutrition first, because we want to do that first when it comes to adjusting for blood pressure. But I also want to get a good baseline of, well, what does your body do throughout the day? What do you do in the daytime with your blood pressure, and what do you do at night? So it's good to check it twice a day. But if you're that person who you're controlling well, you're maybe only on one medicine or you're on no medicines, then once a day is good.
Okay. All right. Well,
I'm just a creature of habit, so it's a habit for me to do morning and evening. A lot of times in the evening, I'm coming in from my exercise routine because I exercise at night. So I already know that it's probably going to be pretty well maintained, because when I exercise, it's always a little bit lower, than usual because of the heavy exercise that I'm doing. But I always really check it in the morning. That's my main go-to, because it's always higher in the morning for me than it is in the evening. So.
Yeah, and see, in instances like that, then I would say if you're taking a supplement, like if you're on medicine and you're taking something at night, then it's the same thing with diabetics, right? When diabetics are on insulin, that's why we have you do a log, because we're able to adjust the insulin, because we don't want you waking up with high blood sugars. We don't want you waking up with high blood pressure. So we make those adjustments to your evening regimen so that you can say, I wake up in the morning good.
Yeah.
Okay.
Makes sense. Okay. Makes sense. I think Bella had a question.
Yeah. Statement. Yes. Slash question. I just wanted to agree with you on the relationship, the effect, that garlic has on high blood pressure. I have been into garlic all my life. And so I know when I got diagnosed with high blood pressure and found out I had kidney disease, I just pumped up the volume, with it. And I did notice a significant difference in indulging in that, as well as taking omega-3 with the fish oils, as you said. I only eat fish and chicken myself. What is that pescatarian type thing? They give everything a name now. But I don't eat beef and pork. So, I'm always seasoning my food, and I don't do salt. I kind of like Mrs. Dash. Tafara, I think you and I kind of talked about, we were fans of Mrs. Dash. But I just wanted to say that I love that you keep, it sounds based on what you've shared, that you keep an open door policy, so to speak, with your patients. Many doctors are either too busy or not personable enough to do that. And I know I love my nephrologist, and I always tell everybody my relationship with my nephrologist is my most important relationship. And so what I wanted to ask of you is more so on a personal note, if you don't mind answering, what made you decide to make nephrology your specialty?
Oh, thank you. It was because I saw someone who looked like me, and I just couldn't understand why was my community so impacted by it. So I had no idea of organ donation. I was in college. I was pre-med, but wasn't sure what I wanted to do, but no idea of organ donation. And so I love to volunteer. So my last semester, and I like to volunteer with things that I don't know, because I like to meet people from different backgrounds and learn things. So there was a group, there was Donate Life came to campus, and they wanted to do a health fair with getting college students signed up to be donors. And I was like, okay, this is sounds like something cool to do. I don't know about it, and I can learn. And so I enjoyed it so much. I, of course, became a registered donor, but I enjoyed it so much to where I continued it after I graduated. And one of the volunteers that I met, she was same age as me, looked very similar to me, and learning her story that she actually had kidney disease, was on a transplant list, and she was supposed to go to a school in the same town that I studied at Florida State, and she was supposed to go to Florida A&M on a sports scholarship. But when she did her screening, and some of you may know that when kids are in sports, they don't get screened for a lot of diseases. But when you enter NCAA sports, you get a urine test. And there are some people who realize at that moment that they have kidney disease, and she was one. And so it just piqued my interest to say, how do you go from preparing to be on a sports scholarship and going to college to now you're on a transplant list and you can't go to college? And at that time, I didn't know much about FSGS, but I still tell myself to this day, if I ever got to meet her again, I feel like that's probably what she had, but I didn't know anything about it. So that kind of piqued my interest. And as I got more involved in visiting the dialysis centers, and you just look around, and it was just like, but no one in my family has kidney disease. So it was something that I never grew up learning or having exposure to. But as my interest just grew and grew, I realized that it was there was a purpose for me there. It was a purpose to be a representation. And anyone who is a doctor will tell you nephrology is not the easiest. It is very challenging. And so I did like that also. I was like, okay, yeah. So this is my purpose in life.
That is awesome.
Wow. Yeah. Thank you. That's what I had, FSGS. And man, thank you so much for, I'm just personally thanking you for your, not only what you do in nephrology, but your obvious love for it. That really means a lot to people like us.
Right.
Thank you.
It definitely means a lot. I got one last question in the chat from Gregory Jones. It says, why is blood pressure readings higher when sitting and lower when standing? It says maybe a 9-point difference.
All right, so that is a great question. And I will tell you, I don't know if Gregory, if you're doing this at home, but a lot of doctors' offices don't do this in the clinic, and we should. So it's called gravity. So when we change positions, our blood pressure is supposed to change. Our blood pressure is going to be a certain level. Then once we sit up, now we have gravity against us, right? We have gravity against our vessel. We have now we're standing, and so gravity is taking a part. So our blood pressure is naturally supposed to drop. Now, it's not supposed to drop by a lot. So if it drops by more than 20 points, then that is a diagnosis within itself. But 9 points is not bad. Top number is supposed to drop by no more than 20 points. And then the bottom number should not drop by more than 10 points. So even when, and my dad experienced this recently, to where he was always dizzy, right? So you go from sitting to standing, and if you move too fast, that blood pressure is naturally dropping. But if it drops too much, he got dizzy. Well, if when he goes to the doctor, they only check him sitting, they don't see that when he stands up, his blood pressure drops drastically. So then he comes home still on the same blood pressure regimen. And I'm like, no, we have to start. We need to pull your medicines away. How about you don't take your pills, and let's see what your blood pressure does. And after a week of not taking his pills, when he goes from sitting to standing, it doesn't drop by a lot. So it's a normal physiologic thing for our bodies to do, but we shouldn't drop by too much. And it is, important if someone's blood pressure is too low, always check sitting and standing. Even at home, I tell my patients, they say, oh, my blood pressure dropped, I got dizzy. Okay, well, let's do your blood pressure sitting and standing. And if it drops by too much, then we need to start pulling certain medicines away.
That's good. That's good. I just want to say thank you, Dr. Brookins. In the chat inside said that Dr. Brookins is so special. I think that you are awesome. We want to thank you for coming and your time and just talking with us and breaking. I mean, you really, really, really helped me. I thank you so much. But I want to end it like this. Is there any last words or anything that you want to share, anything that you want to say before we close the interview out?
I am so grateful for you all for inviting me. Anytime you have something and you think of me, my goal is to educate, to simplify, because I know sometimes you go in your visits and the doctors may just say, oh, everything's fine, or they may only hit on certain things. So my goal is to definitely educate and empower. And I will say, long time ago, we didn't have this sort of a platform where you all get together. I learned so much, from following you all on social media. I learned so much with these presentations. So they're very helpful. And I love how you are engaging and educating and bringing awareness to kidney disease from a personal perspective. So thank you all again. It's always my pleasure to be with you all.
Thank you.
Thank you so much. I had one Trish Phillips said, a remarkable presentation to you. So I want to throw that out. So again, thank everyone. Right now, we are going to have a commercial by Why Not? Why Not? Thank everyone. Thank you so much. Thank you again, Dr. Brookins.
Goes up, it's just how I loaded in. So it's more the message that's than looking at the person.
Hey, what's going on, world? Edward Mr. Why Not Trick is here. I'm the founder and CEO of the Why Not Foundation. Why Not is spelled YNOTT, and it's an acronym for Youth Needing Organ Tissue Transplants. My great friend and Hey, what's going on, world? Edward Mr. Why Not Trick is here. I'm the founder and CEO of the Why Not Foundation. Why Not is spelled YNOTT, and it's an acronym for Youth Needing Organ Tissue Transplants. My great friend and teammate, Mr. Philip Jones, asked me to get on here to talk a little bit about our organization, which he's a part of, for his upcoming conference, which I'm excited for. You all are doing a great job. Him, Tafaro Cook, and Jonathan and the rest of the crew, salute to you all. Keep up the great work. But a little bit about the Why Not Foundation. We provide support for pediatric transplant patients and also promote disease prevention and wellness in the community amongst the youth. So in essence, We go to visit various children's hospitals, hosting teen support groups, trying to educate them on everything from transitioning to adult care to dating and dream building. And also on the preventative side, we host a lot of prevention event, youth flag football tournament, plays, just anything that you could think of to spread awareness about the importance of becoming organ and tissue donors, and also to take care of yourself. We're excited about the relaunch of our new Why Not Connect patient and family support site, where we get on there and we'll host everything from mentoring sessions to online support groups. We host, we have like fun games and activities on there, and just they're able to connect with other youth and other families to let them know that they're not alone. It's hot out here, so if you would like more information, go to www.whynotconnect.com, spelled YNOTTCONNECT on my hat again, or you can Google Why Not Connect, YNOTT Connect. God bless you. Congrats, Philip and Tafaro, and why not continue to impact lives? I love y'all. Mr. Why Not out.
Mr. Barnett, we appreciate you. Our next moderator is Jonathan Traylor.
Hey guys, my name is Jonathan Traylor. I'm a kidney transplant recipient with a podcast called Hope with Jonathan, where we feature other kidney warriors who've either overcome kidney failure by way of gaining a transplant, or they share their kidney journey searching for a donor. And we've had some incredible guests on our show, Mr. Fred Hill. Almost everyone on this panel has been on my show in some way, shape, or form. So, it's a incredible way and a platform for patients to be able to share their story. With that being said, guys, listen, we have an incredible panelist coming on our show. And let me read a little bit about Mr. Cook here. Mr. Cook is a two-time kidney transplant survivor who thrived on dialysis for over a decade. I believe it was 12 years. While on dialysis, he owned a fitness studio where he personally trained and operated the business. Tafaro started exercise programs in the dialysis unit to help patients stay healthy while waiting on a life-saving organ. He is now the founder of Kidney Care Coaches, where they coach people with stage 3 to 5 kidney disease. Tafaro is married and a father of 2. He enjoys exercising, traveling, reading, and building classic cars. And without further ado, I'm going to turn the show over to Mr. Tafaro Cook.
Hey, everybody. How you guys doing tonight? I just want to say, hey, Bella, how you doing? Sharika, how you doing, Dr. Brookins? I just want to say, great presentation, everybody, to the nutritionist, to Dr. Brookins, everybody, man. Y'all did a wonderful job. And every time I'm on these shows, I always learn something. I always learn something different and something new, which is good, And I'm glad we talked about the standing and sitting blood pressure, because that's really, really important. And a lot of people get it misconstrued on, hey, when I'm sitting down, it's lower or higher, whatever. But I'm glad you cleared that up, Dr. Brookins. That was really, really good. What I'm going to talk about is, I'm going to start with blood pressure. I'm going to talk about how exercise impacts your blood pressure and ways it can also help your blood pressure. I'm going to start with that. Then I'm going to finish off with some tips on how exercise can help you if you're a type 2 diabetic. So I wrote down some of my things. I didn't have I forget what is it called, but I just wrote down my stuff. So I said, one thing I just said is, how does exercise lower blood pressure? Exercise strengthens your heart. During exercise, your heart also has a workout. The increased demand for oxygen and nutrients to be, to be sent to your working muscle forces your heart to work harder. Over time, your heart becomes stronger and made more efficient as pumping blood. Yep. This puts less force on your heart and reduces your blood pressure. Let me put my glasses on so I can see. Study was published in the American Heart Association Hypertension. Researchers conducted a randomized controlled trial to understand the effects of aerobic exercise, heart health, and blood pressure. Researchers found that when participants with hypertension performed 30 to 45 minutes of aerobic exercise daily, they were able to reduce blood pressure and increase maximum oxygen intake, 2 signs of a healthy heart. So just wanted to tell people that. Another one I have right here, and you guys tell me if there's any questions because I'm gonna be reading this. Exercise reduces your body weight. So that's another one, which is very, very important. Being overweight or obese increases your risk for hypertension. The two are closely linked. When your weight rises, your blood pressure does the same. This is because the heavier you are, the harder your heart has to work. Study published in 2001 in the Medical and Science and Sports and Exercise research, a group of 112 participants with hypertension, exercise, and weight loss. Hypertension, exercise, and weight loss drastically reduced blood pressure readings when they lost body weight. So that's very, very important. When you lose body weight, be surprised. When you lose body weight, what happens is the heart doesn't have to work so hard. And what I find, a lot of people, I used to train and they start losing weight, is they can sleep better. They have less sleep apnea and all those things. So it has a lot to do with when you start losing weight and things like that, because it makes a big difference with the blood pressure. And just losing 5 to 10 pounds, you'd be surprised how your blood pressure can considerably drop, and you feel so much better. Gives you a lot more energy, and you look better also. So that's a win-win all the time. Right here it says, what type of exercise is the best for lowering blood pressure? So these are some of the ones I wrote down. Cardio and aerobic exercises are any exercises that increases your 80%. So that's your 80% heart rate max. Anything beyond that, this heart rate is considered anaerobic. Anaerobic exercises, which focuses more on muscle strength and endurance. So anaerobic is exercise when you're lifting weights. That's called anaerobic. That's building the muscle. Anabolic is what that means. All right. Aerobic is heart, cardio. That's what that means, cardiovascular. So I just wanted to clear that up. All right. So anaerobic exercise, which focus more on muscle strength and endurance due to its intensity, it can force your heart to work hard. If you have pre-hypertension or hypertension, here are some exercises you may want to try. Walking, cycling, hiking, swimming, jogging, even dancing in the house. I have some clients that just had kidney transplants, and I tell them, you don't even have to go outside. If you turn on some music and just dance a little bit, you'd be surprised how that can even, help you just, getting your steps in and moving. Another thing, which is also important, is you can exercise anywhere. It doesn't take you to go to the gym. You just have to be intentional when it comes to exercise. You just have to want to move your body. So, like I said, you could just do something in the house. I've created exercise and programs for people who don't want to go to the gyms and things like that. And we can just do it. I just create it with the things you have in the house. Just like when I started the program at the dialysis center, we started there and I would bring small weights, but I had patients doing wall push-ups, triceps off the table, all types of things, squats, sitting down into the seat, all those things. And they were getting benefits from it, man. One of the biggest things the doctors saw when they were doing those exercises, patients were, is their phosphorus came down. And they were asking me, like, why did you think their phosphorus come down? And I was like, maybe the phosphorus is getting used up with the muscles because you are using muscles. So the phosphorus started coming down in patients. So that was one thing that was really, really good. Another one right here says, how much exercise should you do to lower your blood pressure? The American College of Cardiovascular says adults should get 150 to 300 minutes of moderate intensity aerobic physical activity per week, or 75 to 150 minutes of vigorous intensity activity per week. Personally, I think combine the two. So I'm like, do some cardio and also do some strength training. They both work together. Now, I'm not telling you to go in there and, kill up the gym and hurt yourself or nothing like that. But I believe if you go in there, you could do a little bit of cardio, and then if the place has some machine weights, or if you want to just do some weights at home. So you can take a walk at home, and then, okay, I'm gonna come home, I'm gonna do, some push-ups. You can do push-ups off your knees. You can do push-ups off the table. You can do push-ups off the wall. There's all types of things you can do. So I just want to tell people that. So I believe, again, doing both works magnificent, because when you strength train, what happens, especially with women, a lot of women were always afraid to lift weights. And I told them, when you lift weights, you're not going to you don't have enough testosterone. I should tell the women, your muscles are going to just lean out, opposed to you getting bulky. That's not going to happen. And you're going to look a lot better, because your body's going to be toned up, and you're going to look a lot better. You're going to feel a lot better, and you're going to be physically stronger. So that's, I used to have to tell women that, because they were so afraid to touch any kind of weights, because they thought they were going to get big and buff. And believe me, it's hard to put on muscle in the first place. So I don't know how that's going to work. Go ahead, Bella. Do you have a question? I'll answer it right now.
Let me unmute myself. So can you hear me now?
Mm-hmm.
Okay. Yeah. So you just actually touched on something that was going to be one of my questions in relation to what you just said about the we as women, but not just women. I've heard some few guys talk about this. So you said that it's really important after, or did you say this? Is it very important after weight loss, especially pretty extreme weight loss? Let's say from anywhere from 15 pounds and up, depending on what size this person was and how much weight they lost, to get into some strength training. Because here's the reason I ask. I have talked to many people who not only from the perspective to which you described, being uncomfortable with that, but they either said, I don't like weights, I don't want to do it, or they have severe back problems, and they said they've gone to places, because not every trainer is a good trainer. And not every trainer is savvy in knowing if a person has a health issue. You know what I mean? So you have a lot of these places where they group people together, and everybody's like jumping around like some, robo person. I'm serious. And everybody can't do that. You know what I mean? And I worked with a guy once, and I said, okay, this is what I can't do for this reason. And 10 minutes later, he's telling me to do what I said. I told you I can't do that because I deal with the sciatic issue. So that will flare that. Oh, my bad. So what are some, I'm sorry, my dog's jumping up here. What are some alternatives that a person can do safely if in fact they do have some type of musculoskeletal issue, or they don't like weights?
Right. First things first is you always want to get a doctor's recommendation if you have a challenge with anything going on, whether you have high blood pressure, diabetes, kidney disease, liver, whatever it may be. You always want to get that consent from the doctor. That's the first thing. Another thing is you have to know your limits. You have to know your limits and speak up, especially when you're talking about group training. For one, group training is important. And I used to do boot camps. But before I started my boot camps with anybody, I would have people sign papers like what's going on with you and everything. And then once I went to that person and I talked to them, I go, okay, tell me what's going on with your back. Oh, this is happening. I'll go, okay, I want you to stay away from this exercise. And I would, make it known. I don't want you doing that exercise. I don't want you doing that. And so you gotta have a safe environment for your clients. That's very, very important. I never forget when I owned my fitness studio, I had a trainer there, and he had people doing some unsafe exercises. And so we had to get rid of him all because of that. You know, he was just having people do all kinds of stuff, and it wasn't helpful. So again, you have to know your body. You have to work with the people who they know what they're doing. Are they certified? Do they have the credentials to do what's going on? So some of the things you can do, and if you know you have a sciatica problem or something with your lower back, stay away from that. But you still can do some things, work around that thing. So if you know your back is hurting, I don't want you doing any stiff-legged deadlifts, anything like that, because you can injure that. But again, you might be able to do some lat pull down, something like that, because that's hitting the upper back and not messing with the lower back. You might be able to do some rolls or something like that. But again, staying away from the lower back. If the lower back is injured, like I said, don't do any deadlifting or anything like that. So I think that's the what I would recommend to work around that injury. I tore my shoulder, my labrum in my shoulder, and I had to rehab it and stay away. But I still worked out. I still did some other exercises and things like that, because you can still do some other exercises. But I suggest you just work around that exercise. And if you have a trainer, you let it be known. And if the trainer tells you do that exercise, hey, no, I ain't doing that. I told you that hurt me. So, you have to speak up, and because we are our best advocates no matter what. Right. And that goes for anything and everything we do. So that's what I would recommend.
Thanks.
To Faro.
Yes.
So in regards to dialysis patients, okay, because a lot of dialysis patients that experience kidney failure, they feel like that they've lost it all, right? They've got the mindset that, oh man, it's over. Man, this is terrible. I'm going through the worst thing in my life. But why is it important for them to continue with exercise and trying to take care of themselves, even though they're in kidney failure?
Well, one thing about kidney failure, and when we talk about phosphorus robs a lot. It snatches a lot of calcium from the bones, so it makes the bones weaker. By doing strength training, it's important for the strength training because it keeps the bones strong. Also, when you're on dialysis, and I can contest to this, when I was doing it for so long, we start losing our balance. It's crazy how you just start losing your balance. You can get up from the machine or from peritoneal and you feel dizzy. When you do exercise, it helps you stabilize. It helps you stabilize your balance. And also, another thing about exercise when it comes to dialysis patients is it creates an appetite. A lot of times when you're on dialysis, I see a lot of patients that don't want to eat. Man, I can't even eat nothing. But when you do a little exercise, it stimulates their appetite and it makes you want to eat some food. So those are just a couple of things that can be definitely help you. What helped me with my arm, I had 12 surgeries in my arm for my fistula. And the doctor gave me a little squeeze ball. And I was like, I said, what you give me this for? He was like, oh, that's going to help you with your arm. I said, I got a whole gym full of weights. I'll just use my dumbbells. And I started banging with my dumbbells, and my arm matured in 3.5 weeks. They were like, man, your arm is, I went back to the doctor, and they were like, your arm is ready to go. And I ran at 600 for 4.5 hours every time. And I did my own self-cannulation. And I had good flow all because of that exercise. And that's just to name a few. And another thing is, it kept my phosphorus down when I was exercising. For some reason, the exercise helped the phosphorus stay low. Yeah. So it was a number of things, man, that helped me out with that.
What about people, though, that say with people with fistulas that it's unsafe for them to lift a certain amount of weight and things like that? What do you say about that?
Well, first of all, listen to what your doctor's saying. I'm not going against what the doctors are saying, anything like that. But from my perspective, like I've had people who had just received fistulas like a week later, had given them a canned good, just something small just to work the fistula so it can mature a little bit, and starting off with light weights. I ain't telling you to do what I was doing or nothing like that, because I was grabbing crazy weights, getting busy. I didn't, but I had no problems with that, but again, I was a lot younger than a lot of people too. So, and it depends on who you are and what you can do. You know what I'm saying? So we can line up 100 people and everybody have a different script on what they can do and what they can't do. You know, some people could start off doing it, but if your doctor recommends you not to do any exercises for the fistula, just to squeeze the ball, then he might know something else. He might have told you there is another reason why I don't want you exercising or doing anything for that, or her, she, or him might have told you that they don't want you doing that. And you can ask the reason. What's the reason? You know, because I had people come to me, was like, man, you exercise with, you know, with your fistula? Like, yeah, I do, you know, and never had a problem with it. But somebody else might have a problem with it. So it's the individual thing, I believe.
Yeah, absolutely. So when you're talking about exercise, one word comes to mind is motivation. And how do patients that are dealing with a chronic illness gain that mental fortitude and that will to want to, you know, get involved and be motivated with exercise? How do they get that mindset?
I think that's a, you know, it's a self thing. You know, you have to be intentional, especially when there was a client I just worked with, and we had to lose a certain amount of weight so he could get on the transplant list. And I was like, you have to be intentional, and you're going to have to sacrifice. This is what you want. So you have to always keep that carrot in your mind. Oh, I want to get on the transplant list. I want to get off dialysis. So therefore, I got to lose this weight. How do I lose this weight? With our nutrition, which is 80% of the game, and then with exercise. And he did what he had to do, and it was a challenge. We started in 21, and 22 he got it done, and he got a transplant, and he had to lose a considerable amount of weight, but it worked for him. And again, I feel you have to be intentional, and there's going to be some sacrifice. It's not going to be a picnic, but sometimes we got to do what we got to do to get what we want in this life.
Absolutely. Any of the other panelists have any questions for Tafaro Cook?
Okay, great. I'm going to go into talking about diabetes. Okay, first question I have is, how does exercise help control diabetes? Regular exercise is an important part of managing diabetes or dealing with pre-diabetics, because when you're active, your cells become more sensitive to insulin. And our nutritionist talked about this, Dr. Brookins talked about this, and also. So it works more effectively to lower your blood glucose, also known as your blood sugar. So by exercising, your body becomes sensitive to the blood sugar. Your body starts to use it up. And that's what you want to create. And that's the problem with people who have diabetes. When I talked to Fred yesterday, Fred told me, man, I run a mile a day, I'm exercising, and I'm controlling my diabetes like that. And I believe, just like Bella has said the same thing, I believe that's the best way you do want to control it, by you exercising and you controlling the things you can do on your own before you start taking the drugs and everything. Controlling it like that, to me, is the best way. And again, somebody like Fred who has will, like, hey, I got to do this. I got to keep myself healthy. And I believe when we go through these things, it becomes second nature, because you're doing it for another reason. You're doing it for your loved ones. You're doing it for yourself. And you're like, shoot, I got to get better. And I think you have all the motivation in the world. But Jonathan, you're right. Some people just don't have the motivation no matter what. You know, they could just be going down the dumps and still can't grab anything to help them up. And I guess that might be just the person who they are. You know, it's just a will thing, if you will.
Sometimes I think it has to do with your support system. If you have a strong support system and they push you to help get you going, then, you know, and they're cheering you on, that plays, I think that plays a huge part.
Yes. And I always had a good support system. And when you do have a good support system, man, I remember, having a fitness studio, and my business partner would see me come in from dialysis with my arm wrapped up, and I had clients and, clients ready to go. He go, "You all right, man?" And I'd be like, "Yeah, I'm gonna be all right." But he always checked on me, and that was cool, because again, my clients, some of them were bodybuilders, fitness girls, doing all kinds of competitions and stuff, athletes, high level athletes. They didn't even know what I was going through. And nor was it my business for me to tell them. It was just about, hey, these are my clients. Let's get to work, But what made me want to work with patients was, I felt like I was living in two different worlds. Again, I was living in this world where everybody it was all about vanity and looking good and exercising. Then I would go to this other world where everybody was sick. And, you know, myself, I was like, man, how can I bridge this? How can I make a difference on this side where, you know, I know how to work with these people, but I want to learn how to work with this lane of people, because it seems like this lane needs it more. And Jonathan, I had people that would sit in the lobby and watch me, you know, helping other people, and they just would not get up and do anything in that dialysis center. And then eventually I had people that would start doing something. They would see other people doing it, then all of a sudden they'd be like, okay, I'm gonna do it reluctantly. But what happened was, and y'all know this, when you start exercising, you start feeling good. Right. That dopamine hit you, you be like, man, you be pumped up a little bit. And you can see the people who were so negative have a little smile on their face. Yeah. They be like, oh, okay, this is not that bad, you know. And then I would have people come in the next day talking about, you tried to kill us yesterday. You were sore, you know, so just give them a little bit, you know, camaraderie and everything. They was, you know, getting on me like, you tried to kill us yesterday and all that stuff. So it kept it light and it kept it fun, because when you go into some of these dialysis centers, man, it's almost like a morgue, man. You know, no one's talking to each other. Everybody's almost seeming like they're waiting to pass. To me, that's how I felt. So.
Right. No.
Thank you, Dr. Brookins. We appreciate it.
Thank you, Dr. Brookins. I think what you did there in dialysis center was incredible. You know, I wish I would have had a mentor like that in my dialysis center. But I think it was
amazing, man. It was amazing to help people like that. And what was crazy was they were telling, you know, just their regular people, and I started getting the floods of clients coming to me from patients telling them like, hey, this guy's on dialysis and he's training us. You need to go to his studio. And so people automatically trusted me, you know, because they saw me working on both ends and things like that. And it was crazy, man, to the point where, you know, they did news stories about me working out, training people and things like that and everything. It was wonderful, man. So I'm gonna go back to this though. I have one right here that says sometimes exercise can raise your blood sugar. And I just want to speak on that. So some workouts such as heavy weightlifting, sprints, or competitive sports causes you to produce stress hormone such as adrenaline. Now, adrenaline raises your blood glucose level by stimulating the liver to release glucose. So again, if you are a diabetic or have high blood pressure, keep in mind that you can lift weights, but you might not want to put that stress on you where you're doing it super maxed intensity. Because we've all been in the gym. You guys all been athletes at one time, and you feel that adrenaline. You be like, I'm pumped. And sometimes that can help, that can create adrenaline, can create that glucose level. That's why sometimes after you work out, your blood sugar will be a little bit elevated because of those things. So that's why you want to be careful with that if you are, you know, pre-diabetic or type 2.
I've actually had that happen.
Okay.
I've actually had that happen, and I was confused. Because, man, I was sweating, and I had a whole really solid workout, and I came home and checked my sugars, and it was high, and I go, what is going on here? Yeah. I didn't understand that, and that's probably what happened.
Yeah, you reached the adrenaline. You know, if you had there's nothing like having a good workout. We all know we didn't got in the car after you worked out. You'd be like, man, I killed it today. I don't care if nobody say that was smoking. Okay, I'm gonna be sore as heck, and it'd be a couple hours later on. You ain't even went to sleep yet. You're like, oh, I'm feeling this mug already. I know, but to us, that's a killer. We feel good. You know that There's nothing like a next day you sore. You be like, ooh, I know I did something. And it feels good. There's nothing like it. You know, we've all done that. But if you are pre-diabetic or diabetic, you have to be careful with that, because the adrenaline, again, it can raise the glucose, and that can be, you know, that can be a challenge right there. So
that's informative right there.
Yeah,
that's some good words of knowledge right there.
Mm-hmm. So, you know, you just have to be mindful in the gym when you know you're going hard, you're sweating hard and things like that, and you like, okay, let me just relax a little bit. But one thing I could say though, from the exercise from your blood sugar raising in exercise, it'll go down eventually once your body calms down and everything. Your body, it'll calm down, and then you can relax and chill, and it will drop, because the spike is only coming from the adrenaline that's being released at the time. So
yeah, I think I had went in the kitchen and made me a couple of eggs for protein to try to knock the sugars down.
Right.
I don't know if that was healthy or not, but that's what I did.
I got you.
Hey, can I ask a question? Dealing with diabetes and also with high blood pressure. This is, I mean, just throwing this out here because for us who are athletes, we always push that one more. You know what I'm saying? So you getting it, and so I got to get this last one, and you strain to get it. And to us from being in the athletic field, you really don't start counting. You really don't start counting until you get to those last 4 or 5 pushes that you really got to push out. And so my question is is that healthy for people who are I'm talking about the straining part, the straining. Is that healthy for people who are on dialysis, or people who are diabetic and are the transplant? Because we got everybody's on here, you know, even with that transplant, that extra, it's the one when you grunt, you're like, I got that, I'm talking. So I know it's good for us if you're not dealing with that, but for the ones who do, is that good for us?
Right. And that's a great question right there, man, because again, this goes back to, what your circumstances is. Fred, you might be that guy who can go in the gym and get those last reps in and kill the game, while somebody else who has a transplant can only do so much, because, if they go that hard, they can have a high blood pressure, your glucose can go out of whack, and it could be a problem. So that goes back to the individual. Just like I said earlier, we could line up 100 people, and 100 people have different situations. So that goes back to being your own advocate and knowing how you feel and what works for you. Now, if you got that, you got that last thing in, and you go home and you're not feeling good and stuff, that could be like, okay, next time I can't do like that. I mean, just like when I was going to the gym consistently, now I do a lot of exercises at home. There were some young dudes, man, getting busy. And like I said, I could only work with them like 2 times a week. Why? Because they was in their 20s. I'm 52. Man, I was like this. I can't do all that. I was too sore the next day. I was like, man, I know my limits. I done did all those crazy workouts like y'all done did. I done had my day. But 2 times a week, I can get busy with y'all. The other days, I'm sitting there watching from afar, like, I see y'all, get busy. Y'all got all the testosterone in the world. I used to be like that. I can't do that now. But I would get in 2 nice workouts with them, and that was it, man. But I couldn't push like that every day hard. It was breaking me down. And that's when you start exercising, starting to get diminished returns. And because you just doing nothing but breaking down and you ain't building no more. And that's just ego lifting. Like I say, when you ego trip, you lose your luggage. And that's what that can happen. So I had to stay in my lane. Like, man, I could do it with you once or twice a week, and that's it. Let the old man do his thing. I'm keeping it real. I would bail out like, nah, I can't do that.
Yeah,
and so that just goes back.
That with my son. My son's 19, and man, he's in there.
I call them young Thundercats. I let the young Thundercats do their thing, man. Hey, knock it out. Knock it out the park. I used to be like that. I'll just sit there and watch y'all put all that weight on and get busy. I come over there every now and then and tell them something. Hey, watch your form. Make sure your form is good. Just that. I'll spot you and everything, but get at it. When you're young like that, you got all that testosterone, your body feeling good. Man, knock it out. Go for it. I'm in a different category. My goal is just to stay in shape.
There it is. There it is. There it is.
Exactly.
I went right there. Like, hey, my goal is to stay in shape. I ain't trying to get hurt out here. I done had enough injuries and everything else. Y'all can have that. Right. And so that goes back to just staying in your lane, Fred. That's why I'm a strong proponent of staying in my lane.
Man, I appreciate that. I appreciate it. Thank you, man.
Yeah. So, even though sometimes, when I was getting up in age, I was looking like, man, I could do it. And I was like, man, I can't. I had to give it up. You know, just like let the young boys do their thing. And, you know, and I remember when I was younger and I would have older dudes come to me like, man, I remember I used to throw up that kind of weight and I'll be laughing at them. Now I'm that guy.
Yes. My son he's 21. He's killing it. He killing it. We work out together. Come on, Dad, get up under. I said, man, no, I'm not. I done did mine. When I was your age, I did that. But I'm not even trying to. I'm like you. I just want to be able to take my shirt off and my wife like it. Yeah, and so I just want to be able to look good. You know what I'm saying? And feel good. Just stay in shape. I said, I'm not trying to get up under all that weight no more.
All right.
That's it, brother. That's it. I'm telling you, man. And I'm telling you, when I had one of them hard workouts with the young boys, my joints next to me hurt, my shoulder, I'll be like, man, I can't. I'll break it down.
I sounded like a Rice Krispie treat, man. I had stuff popping and cracking, and you know, I'm like you, man, just trying to maintain.
Right. And it's good to see the young boys, you know, work out with the young ones every now and then because it motivates you. It gives you some inspiration.
Yes.
It gives you some motivation to get, but you still got to stay in your lane, you know, because them boys, man, they can hit like that, go out, kick it, come back the next day doing the same thing because that body is recovering. Right. And like I said, when you're 20-something years old, 19, 20, you better have all the fun you can in the gym. Do your thing.
Right.
Yeah. But know your body. I think that was the thing. Know your body, because I know after when I went on when I started working out with dialysis, I found out, number one, I had to drain. I drained all the fluid out prior to going to work. I had at this time I was peritoneal, so I drained all that out. But the thing that gets you is you know, you have that open space, you know, with the peritoneal. Yes. And so I went in, man, and I went gung ho. And I end up getting a hernia during that time. And so, and dealing with that for me, the thing was, as big as I am, I'm like I said, I'm 230. I'm a big guy, and so I'm in there and I'm working out with 20s. You know, I had my little dumbbells of 20, and what did it was the mental thing. I'm saying this because it's the mental thing of seeing the younger kids come in or whatever, and even those who were my age. So they grabbing the 50s, the 75s, you know, and I'm like, you know, I feel like I can do that. I know I can do that, but I'm trying to stay in my lane. And so when you're looking at them and you see them talking and they laughing, big you ain't getting. So I hurt myself because I said, I'm gonna show these Thundercats, you know. So I went in and you know, the first 2 weeks I was good, but not realizing because of the little opening in my, you know, the catheter, it wasn't healthy because and then again I was, you know, straining. But so it took that point of understanding, okay, I messed up, but I'm not gonna quit the gym once this thing, you know, the thing works. So I said, time for me to get in, but stay in your lane. So even if I got to do low weight, high reps, that's what I had to live by. Versus like what you're saying, stay in your lane, stay in your lane, know your body. Yeah.
And a lot of professionals do that with the high reps and lower weights. Some of these bigger bodybuilders, they do that. They do the same format and get results.
Yeah, you get results, you know, and I think that, you know, for me, because like, you know, it tones you and it builds your strength. So versus just I don't want that bulk look, because, you know, when you get in age and you just don't want to feel that weight when you lay down. So I think I ain't trying to take over your show, the thing, man. I just
no. You're hitting right on the head, and that's true. You know, I leaned out as like, man, I played ball at 247. I'm 218 right now. I'm like, man, I don't need that extra weight on me. For what? I ain't running into nobody no more.
Right.
They can have that.
Right.
I'm just like you said. I want to just, hey, my wife like how I look. I'm good.
I'm good. Yes, that's it.
Yeah. And I feel good. I could wear a 36-inch waist. I'm good, man. I'm happy. I can put my pants on. I feel good.
Right. We look good. It can help.
Right. And another thing is this: sometimes when our ego goes crazy like that, Phil, sometimes we have to look at like, man, these dudes ain't going through what I'm going through.
Right.
They don't know.
Right.
They healthy. They got two kidneys. The kidneys is working good. I'm in here for a different reason. I'm in here just to stay healthy because I'm trying to get my transplant. I'm trying to live my life so I can do what I got to do.
Right.
And this is the hurdle I got to cross. Now, y'all can go in there and bang all the weights you want, but right now, man, I remember I got sick and I was in the hospital. I got septics when I was on peritoneal. My peritoneal sac burst in my body.
Wow.
And I had to rush me to the hospital. I was septic. I had to stay in the hospital equivalent of 72 days, man. I was messed up.
Wow.
I went from 230 to 180 pounds, man.
Wow.
I was weak as I don't know what. I got home. I couldn't even walk a flight of steps. I went to my kitchen, man, was getting canned goods.
Wow.
And again, that's what we talk about. When we talk about, Jonathan, you got to have some will because you're going to get setbacks, especially in our lane.
Yeah.
So you do what you can. I was taking little Campbell soup cans. I had two cans, man, doing what I can, bench squatting. Pressing off the table until I got, and then had to get an appetite later on, man. Because my doctors told me, they was like, we didn't think you was gonna make it because septics is bad.
Man.
When that happens, your whole body is toxic. So
yes.
That's
what you're saying right now, man, is so on point. With what we're talking about right now, man, because if I'm gonna put it this way, if you don't see through what you're saying in your testimony, if you don't see the importance of exercise now, I don't know what else to say. I mean, to come back from being your whole body is toxic, and you're seeing what that does for you, and it had to be something. What you said, a will, and then also your why. It had to be a why in you to say, why am I doing this? I mean, it had to be a why in there in order for that to happen, man. And this conference and all of these different things, man, what you're saying, exercise to me is key in everything, because this right here, what you're talking about right now, can help prevent being in the place of blood pressure or having diabetes. And then for us who do deal with diabetes, this is what causes us and helps us to maintain. So, man, with everything that you're saying right now, man, I'm hyped up right now, like it's me, because I'm saying this is what we do. And so, you're looking at, like Jonathan was talking about, what saves your life. And this is something that I can really and truly say, being in the place of exercise and walking. And as you said before, it don't necessarily have to be in the gym, but wanting to move. And not being in that place, what you said, not being in a place to where I'm just gonna lay here and let it be, because you can. The whole thing today, what Philip and you guys putting together, it's about you can do something to change your life, and I think that's awesome.
Right, Fred, you are so right, and this is the biggest thing I saw when I started the program in a dialysis center. I start giving people their control back. And that's what exercise is about. You control your diabetes. You control your blood pressure. You control what you can eat, because you getting the control back. Yes. And that's what exercise does for you. Because if you exercise, you can go out and eat the food, because you're going to be in the gym next week.
Right.
Or you're going to go for that walk. You're going to go for that run. You're going to hit them weights, and you feel good. Man, give me that piece of cake. I can eat it because I know what I'm going to do. I'm controlling. I got to control. Because a lot of times when you're on dialysis or all these things going on, you don't have any control. And that's one thing I saw about the dialysis patients, man. They start taking initiative. They got confidence. They felt good about themselves. Yeah. And that was a big thing. Like I said, man, the morale in the place started being lively. I had a couple older gentlemen talk about, man, I'm gonna do more push-ups than him. That kind of stuff. The That's little awesome, back man. And forth. Yeah. It was beautiful. I'm telling you, man, it was so uplifting to me. I still say it was one of the best times. Don't get me wrong, I was going through some stuff, but it was the best time of my life to give back and see people getting happy when I would come in with those. I have 2 buckets of bands and 2 buckets of 5-10-pound weights.
That's cool, man.
And I'll lay them out, and they be like, all right, give me those. I like that band. That's the band I like. They even like your old stuff. I want to start over here doing, triceps off the table, all the kind of stuff, man. Yeah. And again,
you were giving them hope. You gave them hope.
Yeah. The camaraderie. Seeing people do their thing and giving them that camaraderie, and they was happy. they was like, "You coming back Wednesday?" I'll be here. Because I'm gonna tell you, I would even do some after dialysis if I didn't have to be in my studio. And after dialysis, sometimes you be wiped out. But I knew it was still helping them, man. And if I had 2 or 3 people, I was like, man, I'm gonna stay here and help you because. Hey, if y'all want to do it, I'll do it. No matter what, I'm gonna be okay. And I liked it, and it helped people.
But one thing I want to, I guess, ask this question, if it's okay with Jonathan. When the thing that you look at what Dr. Brookins was talking about, you're dealing with, and this is a man question for the men who are watching this, and Tafara, I know you already know the answer, but I just want you to kill it, man. I know you're gonna knock it out the park, because I think when it comes to men, sex is one of the, if a man can't enjoy himself in the bedroom, or can't be in a place where he's pleasing the one that he's with. Now, when you're looking at high blood pressure, the medications, and when you're looking at diabetes, now hear this, out of control. That's what I mean. So when you're looking at high blood pressure and diabetes out of control, will cause the libido of a man not to work. And so my question is, how does exercise help that?
Well, that's a great question, man. And as men, I've even taught men's health classes and stuff at my mom's church, at different churches and stuff like that all over. And that is a very, very important question. For one, what exercise does more than anything is it creates blood flow. And we all know if you want your body to work good, especially, when it comes to sex, you got to have good blood flow. And that's the first thing exercise does. It creates the blood flow. And when you get that good blood flow and that good circulation, your body's you're going to perform a lot better. Another thing what exercise does, especially strength training, is it produces growth hormone. That's why we have testes. So when our testes, our body is, when you're lifting weights, when you're doing strength training, that is signaling to the body, oh, we got to produce more growth hormone because this guy is lifting he's doing some vigorous intensity weight. So that even produces more growth hormone. And that's going to help you too. Once you get aroused, that growth hormone kicks in, and you're off to the races. You're doing your thing. And that's what you want. So, and then another thing, the exercise makes you look good and you confident about yourself. When you take off your shirt, you're like, boy, you see what's going on here? Y'all better go on. And that confidence hits you. You looking good. The girls are staring at you. She's like, man, you look good. And ain't nothing wrong with that. Y'all know what I'm talking about. When you look in the mirror, you see yourself start coming down and you looking good. Man, you feeling good. That means you go perform good. That's how it go.
Right.
And so that's
change the confidence.
Yes. Man, when you looking good, like I said, that confidence hits you, man. I'm telling you, that's the bomb. And another thing is this: the dopamine from the exercise. Once that dopamine hit, these are natural effects, man. Mm-hmm. We are Homo sapiens, and we are not made to be sedentary in our lifestyle. Boom. That's why we are always taught. Back in the day, my dad had a garden. He'd be like, go out there and turn that garden. And I had to turn the garden, work in the garden. And that's what happened when you saw back in the day. My parents, my grandparents, my dad and them would take me to Dayton for the summer to turn my grandparents' gardens over and stuff, do all that manual labor and things like that. But I'm going to tell you, when we ate like that from the ground, when we worked in the ground doing all these things, we were a lot healthier. The only time we start getting diabetes and high blood pressure and all this stuff was because we start being sedentary. We start working office jobs, coming home, chilling, eating TV dinners. We wasn't eating out the garden no more. We stopped all that stuff, eating real foods. My mom in our neighborhood she'd have sometimes a bumper crop of carrots or a bumper crop of cucumbers, run them to Miss Walters down the street. I go down the street, give them to her. She'd be like, give these to your mama. And he'd come back with a whole bunch of okra, whatever it was. But that's what you did all through the neighborhoods. I was running all over the neighborhoods. Miss Waters had a cherry tree. She'd be like, the cherries need to be picked. Tell DeFaro, come on down here and get those cherries. And my mama made pies. And then she would can. We would can back in the day. And see, people forget about that. We would can food.
Yes.
And when you ate like that, you ate healthy. You know,
Yes.
there were no preservatives and nothing like that. First time I got jelly from the store, man, I was in high school. We
That's
didn't
true.
have, we was making that kind of stuff.
Yes.
And when
Yes.
you ate from the ground, doing the real eating and stuff like that, high blood stuff wasn't even heard of.
It wasn't even
You know
heard
what
of.
I'm talking about.
Telling the truth, yo, making the jelly out of the muscadines. You know what I'm saying?
That's
that
what
used
I'm
to be-
talking about, man.
Yes,
Yeah.
And like
Yeah.
you're saying,
I mean,
you
my
know,
dad would
candy-
make, we would make
Yeah, you're right.
oxtail. We would make all that kind of stuff. Beans, all kinds of stuff, man, but come from the garden. And that's
Right.
how you ate. And,
Yeah.
and you got, you know, and so once we start putting all these steroids in the foods and things like that, that's when we start getting the challenges with our nutrition and our bodies.
That's so
it's
true,
all
man.
it's all the chemicals and the GMOs and all that
Yes.
stuff that they're putting in this
Yes.
food now. If our children, my children, aren't careful, there's no telling what kind of diseases and things like that are going to end up coming out because of the result
Right.
of eating GMO and all these chemical preservatives that they're putting
Right.
in the foods nowadays.
Yeah, man. I'm telling you, I come from the old school. My mom made cornbread out of a skillet with the hot,
Right.
with the hot grease.
Right. Yes.
I got Jiffy. I was dating this girl. She made Jiffy. I was like, "What?" I said, "This is cake. This ain't you Fred know what I'm talking about."
Yes.
I
Yeah,
know
my
exactly
brother used to
what
put the
you're talking
crackling in it. You know what I'm saying?
Yep.
She put that crackling in it too, man. What I tell
Yes.
you, hey, but yeah, I mean, but it made a difference, man. I'm telling you, you know, it made a difference. It made a difference. Like what you said, you go outside and grab your own chicken. So I mean, you
That's
know,
it.
those different things when you're looking at in life, man. You pop the beans and all of that, man. You pull the turnip
Pull the
greens, you pull
flour,
those,
pull the
with
feathers,
the
and you
okra.
cook it.
Yes, and then you cook and can,
That's
cook
it.
and can,
Yeah.
cook and can. And so by the end of the
Yes.
summer, man, you still eating in the wintertime when everything closed down. Go get this out the freezer. Go get this out the freezer.
That's just
Go
what
get
my
the
dad
freezer.
would say. Go downstairs, get this, get that, and you come upstairs with a you know, whatever you made in the summertime. And
Yes.
that's what you did. And
Yes.
see, that kind of eating right there is a lost art. You didn't in our
That's
neighborhood. Everybody had a garden, a big
Yes.
garden in their backyard.
Yes.
You had
Yes.
gardens. You tried to, you know, you had to put up the fence to keep the rabbits out and all kinds of
Right.
stuff like that, man. But again, my grandfather and them never experienced stuff like that. And when you did hear about it, I never forget the first time I heard my grandmother talk about my aunt. She said she got the sugar. And I was like, what is that? And
Wow.
that's what they talked about with diabetes.
Yeah,
They called it
sugar.
the sugar back in
Yeah,
the day. And that's what it was. And so, again, these are lost arts, man. And that's why you saw our fathers and grandfathers and them. I remember my grandfather had the biggest arms, the biggest hands. He never
Right.
lifted a weight in his life. He was
Right.
just hard. And I'd be
Yes.
like, man, how you? But he worked out in the fields doing
Yes.
things like that. He worked with his hands and stuff like
Yes.
that. And we don't have those things no more. That's why we have to get back to the gym, exercising, moving our bodies, because if we don't move our bodies, you lose it. What
Yeah.
happens is you start rusting inside. That's all
good.
arthritis is. Arthritis is you rusting internally because you're not moving your body. Once you start moving, it's like you sliding oil to your body. Like that old saying, slide some oil to me. Once you start moving your body, you start oiling up those joints. You start moving again. And the body wants to do those things. Our bodies, again, are not made to be sedentary. We are made to move, man. So
That's
important.
good, man. That's good
Great
because in the day,
information.
you didn't have it was very rare growing up in elementary school and all. It was very rare to see someone who was overweight. It was, I mean, very rare if you think about it, because all the kids and everybody. So now, like you said, we were never meant to be sedentary, but you know, you have all these games and videos and everything now to where no one goes outside. And so, you know, we played from the time the sun come up,
Man.
street light came on. And so
I didn't want to go at a house because if you went in the house, you had work to do.
Right.
I get the hose, drink some hose out the water, and keep it moving, man.
And keep going. You're right, man. And
That's
so
it.
everything that you're saying, man, is so what you're saying, like you were saying, is getting back to, like when you say a lost art, I never heard of it that way, but it makes so much sense because I'm gonna say it like this. You know, we can say the old times, would you be looking at lost art because, man, those days were beautiful. because you're saying it was less. It was very rare in between when you heard someone had cancer. Very rare in between when you heard this. But when you're looking at what you're saying now, so I think I feel that this is so important because everything that we're no longer doing is causing the blood pressure and the diabetes.
Right. And I'm gonna tell you right now, the reasons why the not everybody, but a lot of the reasons from high blood pressure, diabetes is all due to sedentary lifestyle. Not everybody, but the majority is just a sedentary lifestyle.
Right.
Yeah.
That's so true.
Absolutely.
So, man,
absolutely.
I'm telling you, man, I'm enjoying myself, man. Thank you.
Yeah,
this is
I
great appreciate
information.
you, Tafaro, man. Thank you, man.
Hey, thank you.
Great information. I'm gonna hand it back over to Philip. Philip, you ready to close it out, man? This has been an awesome conference. Lots of great information shared.
I just want to say thank you to everybody on here. Thank you to the moderators. Thank you to Dr. Brookins, Lindsay, Bella. If I forgot somebody,
Dr. Spice.
Dr. Rosa, Spice.
Yeah, Spice. I'm a fan.
Yeah.
Tim Jackson.
The first young lady, Jessica. I want to thank all you guys for coming on and supporting this. This was really beautiful. Thank you so much.
It was incredible presentations.
Right.
Great.
Right. Go ahead, Phil. I'm sorry. Go ahead.
Back to you,
I
Phil.
got one more commercial before does his.
Hi. My name is lovingly called Mom Prima. My daughter is Sade Sanders, and we are Prima Strong. Came from K4 Prima, which was established in 2010. In 2021, we changed to Prima Strong. 2021 was the year that I went home to be with the Lord. Helping Sade's passion and making people laugh was her second passion. There were times that she would be in great pain and she would go into the clinic and because she do a little twirl and they wanted what she wanted so that the treatment would go better. I can't even express how much that meant. There were people who said that they had treatments when Sade was there. That's how much she knew the joy in people so they could get treatments. She talked to people about hanging on, being strong. That's why we're Primas, because there was one who wanted to commit suicide. And Sade told him that, encouraged him. And he said if it hadn't been for her, he would have taken her life. So I tell you that her passion for overcoming this is real. As you all know, dialysis takes a lot out of you. But as she became stronger, she wanted to. So she actually met with John Lewis and told him about the issues in our community and how in our community versus others. She really, and so do I. So I want to go forward. That's why I'm doing this. I don't want Kidney Prima just to be something here in Georgia. I want it to be global. I want it to be as big as. I want it to be known about kidney patients as well. That's why I'm glad you let me be a kidney company. You know, if you're ever in this part of the region, that we're here because we're all about awareness, making people know that we're the community, what we can do for them, even in prevention of disease. There are things that you can do to not go all the way in kidney disease. There are things you can prevent. You want to be a part of that as well. Actually, let you know if you're prone to even be affected by kidney disease. And then you want to be able to know what your levels are, the level, which tells whether you're in danger zone to actually be heading toward dialysis. But you want to get your screening done. That's why it's so important to know what your levels are, to know what stage you are in. Because everybody who has kidney disease doesn't have to go on dialysis if you can get a handle on it. But ultimately, I want to see the cure. So we are raising funds so that we can begin to get more involved and more notarized, not me, but for helping people with kidney disease. We have a project for here in Atlanta, so of Atlanta, and we get, and they need to have something too. So gift cards, they use for parking, food, or whatever, and then we give gift bags to children so that they just can have a moment where they don't have to think about dialysis. Because a lot of people think, "Oh, whoa, children are on dialysis?" Yes, children are on dialysis. But I think if you take nothing else away from this, is as a caregiver, I want you to know that you play a major part in their treatments. Hopefully that gives you more information about Prima Strong and my phenomenal daughter, Sade Regina Sanders, Prima. I want to thank Philip for allowing me to do this, and I just hope that you remember Prima Strong. Thank you.
All right, Mr. Cook, you're up.
Okay. Hi, everybody. My name is Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. We have 3 services for Kidney Care Coaches. We have a group sessions, a membership site, and one-on-one services. Again, we coach people with stage 3 to stage 5 kidney disease. Our main goal is to work with our patients and coaching them through nutrition, exercise, and letting them understand their labs, letting them understand what's going on with them with the medications and some of the side effects of medication and all those other things. One of the most important things we do is when we work with people on dialysis, if they're not on the transplant list, our goal is to get them on the transplant list. If they already are on the transplant list, our goal then is to get them recognized out here in our community so they can get a transplant, whether that's a cadaver transplant or a living transplant. And that's what we like to do. So if you want our services, hit us up at kidneycarecoaches.com. Thank you so much.
Awesome. We appreciate you, Mr. Cook. So I just want to thank everybody for joining us today. All the moderators and presenter, Dr. Beans. Actually, I got one more that actually wants to play now. So give me one more. I got one more.
Hey, what's going on, world? Edward Mr. Why Not Trick is here. I'm the founder and CEO of the Why Not Foundation. Why Not is spelled YNOTT, and it's acronym for Youth Needing Organ Tissue Transplants. My great friend and teammate, Mr. Philip Jones, asked me to get on here to talk a little bit about our organization, which he's a part of, for his upcoming conference, which I'm excited for him for. You all are doing a great job. Him, Tafaro Cook and the rest of the crew. Salute to you all. Keep up the great foundation. We provide support for pediatric transplant patients and also promote disease prevention and wellness in the community amongst the youth. So in essence, we go to various children's hospitals hosting teen support groups, trying to educate them on everything from transit adult care to dating and dream building, and also on the preventative side, we host a lot of prevention events, youth flag football tournament, plays, anything that you could think of to spread awareness about the importance of becoming organ and tissue donors and also to take care of yourself. We're excited about our new Why Not Connect patient and family support site, where we get on there and we'll host everything from mentoring sessions, online support groups. We host, we have like fun games and activities on there, and just be there other youth and other families to let them know that they're not alone. It's hot out here, so if you would like more information, go to www.whynotconnect.com, spelled YNOTTCONNECT on my hat again, or you can Google Why Not Connect, YNOT Connect. God bless you. Congrats, Philip and Tafaro, and why not continue to impact lives? I love y'all. Mr. Why Not out.
All right, I had to replay that again because when I went back and watched it on YouTube, it's heavy. I had to figure out a way to replay that. But like I was saying before, I just want to get us today with this conference. Red Hill, Jonathan Trailer, Mr. Cook, Tim Jackson, Dr. Rosa, Bella, Dr. Brookins, everybody. We appreciate your time, your commitment, your day, to not only do, but to educating the kidney community on various subjects like these that are needed to be talked about in a number of different ways and more than just one time. So if you know somebody that needs this information, please pass it along to them. We're all here to help. We're all here on Facebook, Instagram, LinkedIn. So you can get in touch with one of us some kind of way. Most presenters as well are also on those platforms as well if you need to get in touch with them in some kind of way to ask questions you may not have gotten a chance to ask here today, or you're watching the replay. If you're watching the replay, you can still drop a question in the comments, and we'll definitely get those questions to meant for, and hopefully it could be of some assistance to you in some kind of way. So again, like I said, thank you. We appreciate your time, and me and Mr. Cook will see y'all on Sunday. Y'all have a blessed one.
Peace.
Okay, have a good one. Thank you.